in order, Chair, we may proceed.
Okay. No, thank you very much. Greetings to everyone.
Recording in progress.
In keeping with our practice and tradition, I will now bow to my right and bow to my left. And having done so, I will now request that all delegates to observe a moment of silence for prayer or meditation. Thank you very much. Please allow me to remind delegates that the rules apply, and so do the process for virtual sittings. Honorable delegates, before we proceed, I would like to take this opportunity to remind you of the following: that the virtual sitting constitutes a sitting of the National Council of Provinces, that delegates in the virtual sitting enjoy the same powers and privileges that apply in a sitting of the National Council of Provinces, that for the purpose of the quorum, all delegates in the virtual platform shall be considered to be present in the House, that delegates must always switch on their videos, that delegates should ensure that the microphones on their gadgets are muted and must always remain muted unless a member has a permission to speak, that the interpretation facility is active, and that any delegate who wishes to speak must use the raise your hand function. Raise hand function, and by now all members are familiar with the raise your hand function or icon. Having done that, honorable members, I will now go ahead and announce names of new delegates. So I take this opportunity now to announce that vacancies which occurred in the council owing to the designation of Honorable T.B. Matibe and the passing earlier on of S. Mfaela, who was replaced by Kolani Ngwezi, had been filled by appointing or appointment of the following members. T.P. Mama Robela from Limpopo. So Mama Robela becomes the Limpopo delegate, and Honorable N.M. Harted becomes the KZN, KwaZulu-Natal delegate, respectively. The honorable members were sworn in the past week. So we'll now move on then to motions. We'll start with the notices of motions. I would now allow an opportunity to delegates to give notice of motions. Any delegates who wishes to give a notice of motion should raise their hands. Maybe just for a reminder, an emphasis, it's 1.5 minutes per motion and a total of 20 minutes for the respective motions. And if a delegate exceeds time of 1.5 minutes, your notice of a motion will be printed in full on the next order paper. Any notices of motions? Honorable members, we'll start with the Honorable George Mikalakis.
Thank you, Honorable Chair. Honorable Chair, on behalf of the Democratic Alliance,
I hereby move that at its next sitting, this House debates the poor conditions of provincial roads. I so move.
Thank you very much, Honorable Kalakis. The next notice of motion comes from Honorable Mletsane from the EFF. Honorable Mletsane.
Thank you, Chairperson. My apology for not being able to switch on my camera. I've got a problem of a network where I am. I rise on behalf of the economic freedom fighters that the council debate at the next sitting the issue of sewage spillages, which residents of Lejweleputswa local municipality are constantly being objected to. The constant raw sewage spills are also a problem in Mangaung, Moqhaka, and Setsoto municipality in the Free State province and pose a serious health hazard to residents who have had to endure these infrastructural shortcomings for more than a year. I so move.
Thank you very much, Honorable Nchabele.
Thanks, Chairperson. I hereby move on behalf of the African National Congress that in the next sitting in the House debate, the commitment of government to develop a new funding model for students at institutions of higher learning, which will come into effect in the year 2023. The National Treasury said a ministerial task team has been set up to work on the model. I so move.
Thank you very much, Honorable Nchabele. Any other notice of motion? None. We'll then move on to motions without notice. Honorable members. Sorry.
Oh.
Who's speaking? We'll now move on to motions without notice. The first hand is going to be that of Arnold. Honorable Arnold.
Thank you, House Chairperson. I rise on behalf of the economic freedom fighters that the Council notes with concern the shockingly high rate of crime in South Africa as depicted by the latest quarterly statistics on crime which were released this past Friday. Further notes that the statistics point to an 8.9% increase in murder in our country, as 6,859 people were murdered between October and December 2021. And that out of the 6,850 people killed, 902 of them were women, 352 were children, and 232 were as a result of the domestic violence. Acknowledge that the Constitution of the Republic of South Africa under the Bill of Rights guarantee the right to life. Further acknowledge that the murder rate has been steadily increasing over the 5-year period and does not seem to be affected by COVID-19 or the extended lockdown period. Recognize that there are also existing increase in violence in contact crimes together with tax on property, car, and truck hijackings. Further recognize that the South African Police Services spend billions of rands each year without significantly enhancing public safety, has instead failed our communities as criminals triumph in South Africa, as our people are not safe anywhere in the country. We therefore call for police reform, which must begin with a fearless assessment of the South African Police Service and its bloated leadership. I so move.
Thank you very much, Honorable Arnold. Is there any objection? None. The motion is therefore agreed to. Honorable Gillian. Honorable Gillian.
Thank you, Chairperson. Chairperson, I hereby move without notice on behalf of the African National Congress that this House note with concern that the poor state of affairs at Kailitsa District Hospital, where the official bed capacity is 340, but which often sees about 446 patients, is far from being resolved. Further note that according to KDH Chief Executive Officer, Mr. David Binza, the hospital was seeing a strong growing burden of mental health conditions, while there are only one specialist in this area. Therefore, call on the provincial government to grant the 100 million rand that the hospital management and board had requested to improve service delivery. I so move, Chairperson.
Thank you very much, Honorable Gillian. Is there any objection? None. And there being no objection, the motion is agreed to. Next motion will come from Honorable Mikalakis.
Thank you, Honourable Chairperson. Chairperson, on behalf of the Democratic Alliance, I hereby wish to move that this council notes that Park Road Police Station in Bloemfontein, one of the province's largest police stations, has been partially dysfunctional since 2007, when Public Works was planning on doing an upgrade at the facilities. Since then, at least 3 contractors have been appointed and dismissed due to poor performance, and the half-dismantled buildings are still not accessible to the SAPS to do their work. In excess of 48 million rand has also been paid to contractors for work not done and has also not been recovered. This whilst Park Road Police Station is the station with the 5th highest volume of serious crime reported in the country according to the latest crime statistics. That this House calls upon the relevant select committee dealing with Public Works to investigate this matter and to report back to the House. That we cannot allow poor administration to continue putting the lives of South Africans at risk. I so move.
Thank you very much. Any objection to the motion? None. The motion is therefore agreed to in terms of Section 65 of the Constitution. Thank you very much. The next speaker is going to be, next motion will come from Honorable Ndongeni. Honorable Ndongeni.
Please note Mtetwa, Chair.
Thank you, Chair. Good afternoon. I hereby move without notice on behalf of the African National Congress that this House knows that the man accused of rape and murder of 37-year-old Bianca Matros was found guilty in both courts in the George Circuit High Court. Further note that Patrick Mula was also charged with kidnapping and robbery with aggravating circumstances after Matros' body was found between concrete blocks at the open field of the George Wright Club on November 17 in 2019. Also note that it is also emerged that DNA sample found on Matros's body matched the DNA profile Mula, who will be sentenced on March 22, 2022. Therefore, commend the police and the NPA for a job well done in ensuring that the murderer is found guilty for committing this heinous crime. I so move.
Thank you very much, Honorable Ndongeni. Any objection to the motion? None. The motion is therefore agreed to in terms of Section 65 of the Constitution. Honorable Shaik.
Thank you very much, Honorable Chairman. I rise on behalf of the African National Congress that this August House notes with pride the successful foiling of an organized cash-in transit heist where the police met toe-to-toe with armed criminals, and the bravery and heroism of our men and women in blue. Therefore, we salute the South African Police Services for countering this deadly crime. and further salute our intelligence services for the work in intercepting this crime. I so move. Thank you, Honorable Chair.
Thank you very much. Any objection to the motion? None. The motion is therefore agreed to in terms of Section 65 of the Constitution. Thank you very much, Honorable Nana. Honorable Nana.
Thank you. I'm here, Chair. Thank you. Thank you very much, Chairperson. For the Democratic Alliance, I hereby move a motion without notice that this council notes the reports of unsafe water for human consumption in a number of municipalities in the Eastern Cape. That this council notes that Buffalo City Metro has in the past few days issued warnings to residents to boil their water before consumption. Further notes that in Nelson Mandela Bay, water has not only been declared unfit for human consumption with traces of the deadly E. coli bacteria, but has also claimed a life of a child with scores of other children in hospital. Notes that this council sends condolences to the family of the deceased child and further urge both metros, the provincial departments of health and COGTA to take all necessary steps to correct the situation. I so move.
Thank you very much. An objection to the motion? None. And will therefore have this motion as agreed to in terms of Section 65 of the Constitution. Honorable Mtsamai.
Thank you, Honorable Chairperson. I raise on behalf of the economic freedom fighters that the council debate at the next sitting the process of the housing allocation, the exist lack of transparency and ability by the municipality and provincial officials in how houses is allocated to the beneficiaries. Beneficiaries often apply for the housing, qualify only to find that once the houses are built, they are not allocated to the rightful owners, as is the case in the Ward 17, Kwamasiza, Mfuleni municipalities where hostels were renovated and beneficiaries not allocated till today. I so move.
Thank you very much. Any objection to the motion? None. The motion is therefore agreed to in terms of Section 65 of the Constitution. I must say it sounded more like a notice of a motion, but I'm sure we'll move on. These issues can always be examined in some detail a bit later on. Thank you very much, Honorable Mtetwa.
Thanks, Chair. I'm struggling on my gadget today. Honorable Chair, allow me to raise without notice on behalf of the African National Congress that this House note with concern the increase, Chair, in the incidence of cash and transit has and reported in the national crime statistic. Equally, Chair, note with pride that the successful breakthrough made by the police against crime. Therefore, Chair, I'm sorry, Chair.
Yes, please proceed. Yeah.
I'm sorry, Chair. I made a wrong mistake here. I said I wanted to raise on behalf of the African National Congress that this guest house note with concern, Chair, the emerging pattern of organized grassroots protest against the employment of the foreigner national by the local business. That at the core of this, Chair, protest is the competition for scarce resources, that if not controlled and guided, these protests can deteriorate into violence and lawlessness. Chair, we want also in conclusion that the failure of coordinated and integrated leadership in addressing this challenge of migration by government has arisen to this protest. Therefore, I call on the Peace and Stability Cluster and the cabinet level to speed up and design an integrated roadmap towards addressing the problem of migration in South Africa. I further call on African Union to expedite, Chair, the framework for a regional integration. I so move, Chair.
Thank you very much. Any objection to the motion? None. The motion is therefore agreed to in terms of Section 65 of the Constitution. Any other motion without notice? None. We started with Arnold, so the hand should be lowered, I guess. So I'll ask the table to lower the hand of the Honorable Arnold. Thank you very much. We will then proceed, honorable members, to the subject for debate and discussion. And this is printed on the other paper as indicated. This is the debate on mental health for all, giving priority and greater access to mental health care for all. Our first speaker is going to be Honorable Dr. S. Zomo, the Deputy Minister of Health, who will open the debate. Deputy Minister.
Honorable Chairperson of the NCOP, Honorable Masondo, the Deputy Chairperson, Honorable Lucas, Honorable Ministers, Deputy Ministers present here today, Honorable Premiers and MECs of Health of various provinces, Honorable Chairperson of the Select Committee on Health and Social Services, Mayor Gillian, and members of this committee, Honorable members of the House, good afternoon. Let me start by actually conveying our apology on behalf of our Minister Dr. Pasha, who has delegated me to be in this debate because of other pressures in the department. We are here responding to a theme, mental health for all, giving priority and great access to mental health care for all. We know in this topic, we have to do the streamlining the Department of Health in delivering a comprehensive response to mental health. And I hope that my colleagues, MECs who are logged in here, will also be able to expand on this topic. I've also noted the various topics that some of our colleagues are going to discuss: destigmatization, substance abuse, and harnessing human potential regarding economic opportunities. We want to start with the World Health Organization definition of mental health, where it states that one, I quote, a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her own community. This is based on the understanding that the World Health Organization puts this in their dictum, that there is no health without mental health. And in the definition of health, which actually by WHO again states that a state of complete physical, mental, and social well-being, and not mere the absence of disease or infirmity, which was therefore adopted in 1978 in a very powerful meeting in Alma Ata Conference. Several efforts have been made to pay special attention to mental health. However, mental health conditions continue to be among the leading causes of ill health and disability worldwide. In South Africa, the latest estimates of the global burden disease, mental, neurological, and substance abuse conditions make up to 18% of the total years of life lived with disability. It is estimated that about 1 in 3 persons would suffer from a mental illness in their lifetime, whilst about 16.5% from a mental illness in 12 months period. This is an alarming picture in our country. Mental health conditions vary according to severity and impact. For example, anxiety disorders and major depressions are among the most common conditions, while schizophrenia and bipolar mood disorders are less prevalent, yet they pose the major disruptions to household and consume a significant social care and household economic resources. Depression in men can manifest through a risky behavior, anger, aggression, agitation, and rage. It may also manifest through emotional withdrawal and hopelessness. This is where we need universally recognized standards in mental health case for men in our country. This will at the same time address the scourge of gender-based, which becomes a byproduct of an abused and a mentally unstable man. Let's go back to the fundamentals of this matter. It is critical to remind ourselves that mental health conditions do not occur in isolation. People who experience physical illness often experience psychological and mental health difficulties. There are high levels of comorbidity with other health conditions such as HIV, non-communicable diseases, maternal and child health, resulting in poor treatment outcomes. There is a substantive research evidence pointing out that linking people with HIV who are twice as likely to be depressed, while those with non-communicable disease are 2 to 5 times more likely to suffer from mental health conditions. This consequently impacts on adherence to medication and ultimately results in poor health outcomes, including mortality. Also, high levels of antenatal and postnatal depression significantly affects the mother-infant bonding and the development of children. This burden of mental health on health, social and economic system is so much unmeasurable. Mental health has multiple biological, psychological, and social determinants which interact in a complex manner to either provide protection of mental health or increase the risk for development of mental illness. This shows that a combination of genetic vulnerability, childhood trauma, and adverse living conditions brought about by poverty may predispose a person to a major depressive episode. Literature provides detailed explanation on the relationship between poverty and mental illness as described as a vicious cycle. You will recall that in South Africa, these patterns have been exacerbated by our history of violence, trauma, exclusion, isolation, racial discrimination, including separation, such as migrant workers, as detailed in the Truth and Reconciliation Commission report of 2000. Other causes of mental health problems are associated with genetics, biological and cultural risk factors. These include hereditary, hormonal imbalance, socioeconomic stressors, adversity, including early childhood adversity and neglect, gender-based violence, intrauterine adverse factors, migration and immigration, and the associated social isolation culture shock. Children and adolescents are not spared from mental health difficulties. Research evidence shows that diagnosable mental health conditions affect 14% of this population, while suicides tragically claims lives up to 700,000 people every year, which equates to 1 person every 40 seconds universally. Furthermore, substance abuse, including alcohol, tobacco, and illicit drugs, predispose people to increased risk for mental disorders, crime, violence, and injuries. All these are calling for a response that is commensurate to the mental health demand and need on the ground. The question remains, are mental health services accessible to the people who need them? The mental health treatment gap has been documented internationally and in our local context. About 70 to 95% of people with mental disorders in low and middle income countries are unable to access mental health services. The treatment gap has been further put on the spotlight by COVID-19, which further denied many people with mental illness the treatment they are entitled to and deserve, while it also increased pressure of many people as a result of isolation, loss of income, of all which led to the depression in some cases. The pandemic has illuminated the urgency of a global and population-wide approach to mental health care, treatment, and rehabilitation. Our country has not been spared from the drastic impact of COVID-19 on the mental well-being of our people. The pandemic has exacerbated the mental health challenges facing our country. The impact of COVID-19 on mental health services came through the inability of the health system to prioritize mental health services during the pandemic. It has further been associated with increased anxiety, loss, social isolation, increased food insecurity, poverty, and domestic violence and femicide, which are serious predisposing factors for mental illness. The pathology of COVID-19 is such that it has direct effects on the brain and causes a number of mental ill health symptoms, including anxiety, depression, psychosis, and cognitive impairments. Scholars have projected that numbers of those requiring mental health services will substantially increase, and the demand for mental health and psychosocial support will be greater than ever. Worldwide, it is preempted that mental health systems will be overwhelmed and not cope with the demand for mental services due to COVID-19 pandemic impacts in societies. While the COVID-19 active cases are declining and the recovery rate seems to be promising, including the uptake of vaccines by South Africans, the physical, mental, and social economic impacts and distress on our people remain. This includes the mental well-being of health providers and frontline service providers across all levels of care. This is more critical as efforts are underway for reset, recovery, and recalibration of the health system so that it can address the fundamental services that we put in the back burner during the pandemic. It is evident that the cost of inaction are life-lasting and substantial, and that the magnitude of mental health burden must be matched with the response and attention it demands and warrants. As we battle with physical effects of COVID-19, we should also be strengthening our mental health services to be able to deal with the potential increase in mental health problems because of the COVID-19 pandemic. We need to revisit the resourcing of mental health services. We know that perceived stigma, embarrassment of poor mental health literacy are key barriers to seeking help from mental health problems, while social support and encouragement from other aids, the helping behavior, are very critical. We need to address the stigma associated with mental illness and strengthen interventions to educate the public and increase mental health literacy. We cannot, however, Chairperson, forget the life-as-a tragedy that we recently experienced in Gauteng province. Such events must never revisit us. We therefore need to improve mental health systems and improve them with speed. We have made major strides in implementing recommendations by the Human Rights Commission from their investigative hearings that were held in Gauteng Marathon Project. At the same time, forensic mental health services continue to plague the health system. The department is faced with accumulation of referrals for mental observation and state patients awaiting hospital admissions, languishing in correctional facilities. We have put a variety of interventions to address this area, some of which include improved collaboration with stakeholders within the criminal justice system. Inter-sectoral collaboration on mental health is another critical aspect. It is apparent, however, Chair, that neither the state departments nor mental health civil society organizations are able to provide comprehensive mental health services as independent entities. We need a multi-sectoral mental health approach and stakeholders, including mental health care users, to coordinate and effectively address the service demands. Honorable Chairperson, we have a total of 379 community-based mental health NPOs that are licensed and funded by the provincial departments of health. We applaud the men and women in these facilities as they are providing a valuable service to our own who are unable to do much on themselves. The important role played by the NPOs in providing community-based mental health services cannot be overemphasized. Their interventions are multi-purpose and cost-effective in bridging the gap between the medical and social approaches to care, which is central to the integrated and comprehensive community-based models of care that underpin the recovery approach. Most importantly, the NGO services are culture sensitive and tailor-made to the context of local communities and cultures. Strategic partnerships with NGOs is pivotal towards attainment of a paradigm shift towards accessing biopsychosocial community-based mental health interventions. One of the recommendations of the health ombudsperson following the Life City Minute tragedy was that as a department, we need to review and strengthen the regulations on licensing and procedures for these facilities, that it must be adhered to and must be also in keeping with the laws governing the service. It is my pleasure to report, Chair, that this house that we have developed these guidelines for licensing of these facilities in 2018 and now are in the final process of concluding the regulations. The Health Ombudsperson also recommended that the South African Human Rights Commission undertakes a systematic review of human rights compliance and possible violations nationally on mental health services. Chairperson and honorable members, the reviews by the South African Human Rights Commission were undertaken in 2017 and the report was released in 2018. The report largely found gaps in mental health systems across all levels of health systems. These include, among others, prolonged and systematic neglect of mental health at level of policy implementation, considerable underinvestment in mental health, barriers in access to mental health services, particularly in rural areas, lack of mental health infrastructure and human resource, the poor state of mental health services in the criminal justice, forensic and correctional services. Chairperson, I am pleased to report that we are hard at work to ensure implementation of these recommendations in order to further strengthen our mental health systems. While much still needs to be done, we have at the same time made strides in the implementation of the National Mental Health Policy Framework and Strategic Plan 2013-2020. The outcomes include, among the following, Chairperson. 1, collaboration with the University of Cape Town and the Medical Research Council to conduct a study to develop an investment case on mental health. We are in the process of developing a costed plan to implement the recommendations made in the report. This will improve the resourcing models and allocation of resources on the key strategic programs in the country. Number 2, additional funding has been allocated by National Treasury for strategic purchasing of mental health and forensic mental health services through contracting of additional psychologists, psychiatrists, and registered counselors to complement the already available human resource capacity to render mental health services at primary health care and to reduce the backlog of forensic mental observation cases. By December 2021, 85 of these professionals had been appointed in provinces using this funding. We will be extending the professional category under this grant with social workers and occupational therapists in this financial year. 3, to improve integration of mental health into the general health services environment, we have attached 40 psychiatric units in general hospitals. This will help us improve access to mental health services, contribute to the fight against stigma, improve efficiency in the utilization of resources, and ensure that people are treated nearer to where they live in their homes. Number 4, regarding capacity building on mental health, we have trained 1,660 medical doctors and professional nurses working in mental health facilities as part of the program initiated in 2019 to equip them with the skills on clinical management on mental disorders. 5, as part of the infrastructure revitalization, we are incrementally renovating dilapidated infrastructure for mental health and those that are not fit for purpose to render mental health services. This includes the plans to construct forensic mental observation units in Limpopo and Gauteng provinces. Number 6, we have activated Section 71 of the Mental Health Care Act of 2002 and established a ministerial advisory committee on mental health by regulations. This 19-member committee comprising of experts, government departments, and civil society representatives play a critical advisory role in the area of mental health. This is one key intervention that is to enhance our governance and leadership in mental health. Number 7, in order to address substance abuse and its related public health consequences, the National Health Council approved a health sector drug master plan 2019.
As you move towards closing, Deputy Minister.
Okay, this document outlines strategic activities that were implemented to address the problem of substance abuse and its related public health and social consequences. I will continue, Honorable Chairperson, later on when I'm to actually close that, because there are but few points. Thank you very much for this opportunity.
Thank you very much. Our next speaker is going to be Honorable M.N. Gillian. Honorable Gillian.
Honorable Chairperson, Honorable Deputy Chairperson, Honorable Deputy Minister Blomo, all Honorable MECs present in the House, all delegates, Honorable members. Currently, we are living in societies where mental illness is prevalent amongst individuals, and it could be our loved ones, friends, or colleagues. Recently, according to stats, mental illnesses are leading factors to mental health disorders, amongst other problems in individuals in all their life aspects. It is home, school, and even in the workplace. The COVID-19 pandemic may have caused a possible rise in incidents associated with mental health issues, which may have led to suicidal behaviors, attempts, and ideation and actual suicide worldwide. Not only did the COVID-19 pandemic impact the economy of many countries worldwide, but it also had a huge impact on our mental well-being. The unpredictable consequences and uncertainty surrounding public safety, job security, quarantine and isolation, fake news and myths about COVID-19, particularly abounding in social media, may negatively impact an individual's mental health, causing depression, anxiety, phobia, and traumatic stress. It has been established that around 90% of global suicides are individuals who suffer from depression. This has been summarily reported to have been occurring in the past epidemics and pandemics. Though suicide may not be the only result to mental illness, there are other contributing factors like bullying, working condition, and public shaming can also result in mental illness. And this requires serious attentions and need to be addressed at all levels that require partnership between the healthcare sector and other sectors like schools, non-profit organizations, etc., meaning the need for seamless links between mental and physical health care can be of great assistance in curbing and dealing with mental illness. It is noted that issues of mental illness can be related to the triple challenges of poverty, unemployment, and inequality, whilst trying to come up with strategies that can help curb the above-mentioned challenges. Mental illnesses becomes a priority. Honorable members, the 14th to 17th February 2022 was the Teen Suicide Prevention Week, not only in our country, but in the world. The WHO states that more than 800,000 people lose their lives by suicide a year worldwide, and teen suicide is particularly prevalent between the age group 10 to 19. The South African Federation for Mental Health states that in South Africa, 9.5% of teenage deaths are due to suicide. The shocking stats illustrate that there is much need and support that must be provided to assist everyone that is going through challenges of mental health illnesses. Chairperson, furthermore, dismantling the stigma surrounding mental illness is crucial, and this requires collaboration of government departments, parents, teachers, learners, and NPOs. Suicide is preventable provided that help in the form of policies and interventions exist. This will also enhance awareness about how, through action, we can help support all people, especially young people who might be struggling. Over the past decade, calls to address the increasing burden of mental, neurological, and substance use disorders and to include mental health care as an essential component of UHC have attracted mounting interest from government. With the inclusion of mental health in the 2015 Sustainable Development Goals, there is now a global commitment to include mental health among the highest priorities for investment as a health, humanitarian, and development priority. Moreover, research reports have found that between 70 and 95% of people with mental disorders in low and middle income countries cannot obtain mental health service due to financial constraints. This includes South Africa, and we are far from the WHO guidelines in providing adequate mental health care. There is a huge gap to fill to redress the mental health illness to be accessible to all. Honorable members, the WHO Mental Health Atlas initiative commenced in 2001. Our understanding of health systems and ability to monitor progress towards the ambitious global mental health goals outlined in the SDGs has improved significantly, and yet significant gaps still exist. In 2019, the SAFMH reported that only 3 provinces out of 9 provinces have child psychiatrists working in the public sector. These challenges are being addressed through the Department of Health in ensuring that mental health illness programs are available in our healthcare sectors. We commend the department under the leadership of Minister Joe Pasla in taking critical steps forward to strengthen the mental health system, including reforming the Mental Health Care Act 17 of 2002, and the development of the South African National Mental Health Policy Framework and Strategic Plan 2013 to 2020. The policy framework and the strategic plan 2013-2020 identify key activities that are considered catalytic to further transforming mental health services in South Africa and ensuring that quality mental health services are accessible, equitable, comprehensive, and are integrated at all levels of the health system in line with WHO recommendation. The purpose of this policy is to give guidance to provinces for mental health promotion, prevention of mental illness, treatment, and rehabilitation. The policy is intended to be comprehensive in its scope, addressing the full age range and covering all mental disorders, including comorbid intellectual disability and substance use disorders. Chairperson, lastly, the tireless work done for the adoption of the NHI to promote equity in health service delivery towards universal health care will help in ensuring that there are enough resources that will contribute towards rapidly responding to health challenges like mental health issues. Honorable members, infrastructure is a key pillar supporting the fundamental aim of promoting improved standards of care and well-being for all patients, together with a good experience of the healthcare system. In parallel, the healthcare system and staff must support elective health promotion, prevention, and self-care of the whole population. Subsequently, the department has made significant progress on the 21 mental health infrastructure projects in the different provinces. Out of 21 infrastructure projects, 9 projects are complete and 12 projects are in progress. This is a huge achievement, and good progress is forging a way forward to tackling the mental health care in our country. Research has illustrated the needs to plan and strategize for solutions to mental health care issues. Mental health illnesses is prevalent in schools and workplaces, which ultimately has an impact on our daily lives in different ways. As government, we have various departments that can work together in knitting realistic solutions in developing our country and its people in its relation to mental health illnesses. We still have teachers and employers that have a very stereotypical view of issues related to mental health illness and the stigma attached to the condition. The Mental Health Care Act 17 of 2002 will help schools and workplaces preparing thorough, insightful, and accessible plans for all that is in need of it. The Act will assist in enhancing positive mental well-being and resilience for better development. Honorable members, it is important to mention the importance of collaboration in tackling the issue of mental health illnesses. The district development model was designed to ensure rapid service delivery, and it is now the time that the different departments, namely health, education, and social development, work together and merge the processes and procedures to eliminate hindrances to services related to mental health illness. Chairperson, let us use the Act to ensure that we respond to the needs of all people in South Africa and create a mental wellness in all our spaces. I thank you.
Thank you very much, Honorable Gillian. Our next speaker is going to be Honorable Honorable Baga.
Masbulele Sihlalo. Am I audible?
Yes, you're audible.
Thank you.
Loud
Thank
and
you,
clear.
Thank you. Honorable Chairperson, Honorable Minister, Deputy Minister, Honorable members, and fellow South Africans, good day. Chairperson, it is important to first express our sincere condolences on the passing of the South African musician Ricky Rick, namely Muzwendlovu Makhado. It is alleged that he suffered from depression and that may have led to his cause of death. However, that has not yet been confirmed. May his wonderful soul rest in eternal peace. Chairperson, the debate we are having today happens at a critical time in our country when we are confronted with high unemployment rate, especially amongst young people. It happens at a time when leaders of this society are trying to think deep as to what needs to be done to save our young people from crime, drugs, and focus on positive things in life. Let me zoom in on a few areas that are critically important as part of this debate. One of these areas or incidents is the horrific life epidemic, which we must learn lessons from. Mental health is still the stepchild of health and remains underfunded and under-resourced. This is a reflection by Christine Ngumalo, who lost her sister Virginia Makpela during this tragedy. Now, I'm sorry, Chair. She goes further to say, the worst came when we were told about the closure of the facilities. We received an SMS telling us that she has been moved and later received a call from Ethel Ngube, the director of Precious Angels, informing us of a passing. This is but one incident of many which had occurred within Life as Isimeni, and how the citizenry of this country looks at politicians and government leaders. There's a clear call on both the national and provincial government to do a lot to protect and cater for mental health patients. With the COVID-19 pandemic, it is important to keep people informed on what is happening and the well-being of their loved ones kept in different institutions. Having said all the above, about 144 lives lost at Life as Isimeni, at the very least, someone must take responsibility for the lives lost. Any discussion about the ills and what needs to be corrected in assisting our mentally ill persons can't start in abstract. It has to be drawn from the Life as Isimeni tragic events. More needs to be done to address mental health issues affecting young people. During the month of February, the world observes Teen Suicide Prevention Week. The focus is on adolescent and youth physically and mentally health challenges, as well as the extent to which COVID-19 pandemic increases mental health concerns amongst young people. According to reports, since the COVID-19 pandemic outbreak, the mental health of young people has deteriorated considerably, with a rise in adolescent depression, anxiety, and self-harm. The pertinent question we must ask ourselves is, how can we effectively assist and support young people with mental health challenges, particularly during COVID-19 in schools, universities, workplaces that have been disrupted for a while? We need to look thoroughly at the impact of COVID-19 amongst young and old South Africans. In that way, we'll be able to see as to what interventions need to be undertaken urgently so as to save lives and be a government that people are proud of. The Department of Health, Social Development, and Basic Education must engage in an effort to run mental health awareness campaigns and make sure that counselors are available at schools in order to assist learners with these challenges. Data presented by the South African College of Applied Psychology suggests one in 6 Africans suffer from depression. And that means that some people with HIV have a comorbidity, which is mental disorder. 41% of pregnant women are depressed. This is an indication of how mental illness has been neglected by the health system. Depression, anxiety, and similar mental health challenges are complex. Sometimes even when people have support, they still struggle. There's a need for greater mental health awareness and access to affordable, effective services. The greatest pain with suicide is the pain left with those who are leaving behind. The government has to make sure that accessibility to mental institutions and assistance is effective and render services to those that require them. Our government has to assist in taking away the stigma on people who come forward needing help. Chairperson, I hope this is not just a debate, but an attempt to turn things around, an attempt to ensure that all South Africans are taken care of to avoid another Life as Isimeni massacre. I thank you, Chairperson.
Thank you very much, Honorable Baga. The next speaker is going to Honorable M. Meth. Meth from the Eastern Cape, MEC for Health. Honorable Meth.
National Council of Provinces Chairperson, Honorable Masondo, Honorable Chairperson of the Select Committee on Health and Social Services, Honorable Gillian, Department of Health Deputy Minister, Honorable Dr. Thomo. Allow me to greet all the honorable members of the House, and I say good afternoon to you all. Chapter 10 of the National Development Plan has outlined 9 goals for the health system to be realized by 2030. Goal 4 is about the reduction of prevalence of non-communicable diseases, in particular the chronic diseases, by 28%. Goal 3 of the Sustainable Development Goals, which is about good health and well-being, emphasizes the importance of strengthening prevention and treatment of substance abuse, which contributes to mental health. The Eastern Cape Department of Health is serious about mental health. To this end, we are strengthening mental health teams, and we have established a provincial task team. Our 5-year mid-term strategy framework eloquently articulates the state of mental health services and plans as follows. The infrastructure of psychiatric facilities has degenerated over time, and this is coupled with a bed shortage of 1,600 in the province. Mostly the beds are concentrated in the western part of the Eastern Cape province. And also due to redemarcation, 320 beds of Mzimkulu Hospital moved to KwaZulu-Natal. The burden of disease has shown a radical increase of substance abuse in the province and the country, thus increasing a need for social service and rehabilitation. There is a critical need of facilities offering rehabilitation services to augment the 91 beds available from public and civil sector. As part of strengthening the service, the National Department of Health appointed an administrator for mental health services to support the province. The service platform will be strengthened through implementation of community-based psychiatric services within primary health care, strengthening of 72-hour observation in the district hospitals, as well as focusing on acute and chronic inpatient management. There is a plan to increase acute beds in the eastern part of the Eastern Cape province. During this term, the department will focus on strengthening the prevention of mental disorders, drug and alcohol abuse, and provision of sufficient resources of mental health. Community-based approach to rendering mental health care will be promoted, seeking to strengthen access to appropriate services at the appropriate level of care. Addressing the inequalities of mental health care will be a focus area to ensure our most disadvantaged communities have access to 72-hour acute psychiatric care at designated facilities, as well as services that speak to the burden of mental disease. Mental health teams will be established. Mental illness associated with substance abuse is a public health concern, and partnerships will be explored to render the relevant services to prevent and treat substance abuse effectively. Mental health has become an important public health matter globally and in our country as we attempt to strengthen our health system and create a resilient society where everybody is able to fulfill his or her potential. Mental health goes beyond a family or government issue. It's a societal issue that needs all of us. In an ideal world, we would teach communities life skills and psychiatric skills so that they will not ostracize people with mental illnesses. Let's be the generation that bites the bullet and not only openly talk about mental health, but also join hands together and embrace those with mental challenges or disorders. In the Eastern Cape, we are hard at work, ensuring that we continue to turn the tide and ensure that we continue prioritizing mental health services. We are working with NGOs that provide long-term care facilities for chronic mental care patients and halfway houses. We are currently filling vacant posts through specialists specialists continue leaving to join the private sector. We are doing our level best to give the best possible care. Our purpose is strengthening community mental health and ensuring that, one, equitable access across the province to 72-hour mental health assessment units, two, safety of healthcare workers and patients while undergoing 72-hour assessment, three, to ensure adequate infrastructure, appropriate medication, and appropriate knowledge and skills of healthcare workers, and lastly, adequate knowledge of the mental health care and the correct use of the Mental Health Care Act's forms. Clear pathways for district hospital to specialized facilities are being mapped so that referrals can be escalated to relevant specialist care, while stable patients can be down-referred to appropriate lower level of care. We are improving access to ongoing continuing professional development activities for clinicians so that we can strengthen the clinical management of mental health conditions at district hospitals. Community and primary healthcare clinics are also part of what we are doing. We will advocate outreach programs for specialized psychiatric facilities to support their surrounding district hospitals. In the sixth administration term of government, mental health and mental health services are receiving paramount responsiveness in the Eastern Cape. In ensuring that we keep track of this, we have established a provincial trust team of clinicians to drive the turnaround in endeavor to facilitate and coordinate the strengthening of mental health services and interface with the Office of the Health Ombudsman. Honorable members, we have covered some ground in providing mental health services in the province, where we have ensured that there are specialized hospitals for mental health care. We have appointed a specialist in child psychiatry at Nelson Mandela Academic Hospital. We'll be embarking on the renovation of Tower Psychiatric Hospital. We have concluded the refurbishment of the child psychiatry unit at Fort England, and we have appointed head of department in psychiatry at Fort England. We are also engaging stakeholders to promote community residential care and daycare services throughout the province. Community-based rehabilitation centers will be established at district level. Detection of management of child and adolescent mental disorder will be a primary health care. We will all establish halfway houses around the province to prepare integration of patients back to their communities. Department also has 3 review boards located in Gqeberha, Komani, and Mthatha. These review boards, which each have 4 members comprising of chairperson, a healthcare professional, a legal expert, and community member, are able to service the eastern, central, and western parts of our vast province. Honorable members, 42 of our facilities have been earmarked to offer psychological services. These will be even spread out throughout our 8 districts. A lot has been said about our hospital since the release of the report by Prof. Makgoba in 2018. We have also taken the recommendations of Ombudsman seriously, and within available resources, we have appointed a contractor for the renovation of Tower Hospital and addressed the issue of social workers needing communication tools. The Mental Health Directorate at the provincial office has been created. Although we have been struggling to find a suitable candidate to occupy the positions since the external advert process was not successful, we embarked on the internal process in an attempt to find and reassign a suitably qualified SMS member with appropriate skills and qualifications. Eastern Cape Department of Health will continue to pursue implementation of the rest of the Ombudsman's recommendations soonest. Between our 6 specialized hospitals and units for mental health, we have combined 1,432 beds at Elizabeth Tonkin, Fort England, Komani, Tower, East London Mental Health Unit, and Mthatha Mental Health Unit. All what we are doing and planning to do is aimed at ensuring mental health is accessible for all and ensuring greater access to mental health care for all in the Eastern Cape province. Thank you very much, Honorable Chairperson.
Thank you very much, Honorable MEC. We will then proceed to the MEC of Health, Free State, MEC TU. Let me just also take this opportunity to indicate that after the MEC has spoken, Honorable Winnie Ngwenya will take over and chair or preside over the sitting going forward. So without any waste of time, we'll move on to MECTU. MEC.
Thank you. Okay. Thank you, Honorable Chairperson of the NCOP, the Honorable Minister or the Deputy Minister for Health, and the honorable members of the NCOP. Today, we are discussing the mental health for all, giving priority and the greater access to mental health care for all. The Department of Health nationally has prioritized the mental health as it is the 5th burden of disease in the quintuple burden of diseases in both public and private healthcare systems. The Free State Department of Health provides comprehensive healthcare based on primary healthcare principles built around the district health system framework, utilizing the health system government and accountability model. The provincial office and the 4 district offices plus 1 metro within the municipal boundaries manage the healthcare in a widely distributed and appropriate health facilities with the support of the effective referral system. The referral system makes use of free commuter transport network to transport patients between the primary, the secondary, the tertiary, and central healthcare facilities. Most of the facilities are in satisfactory physical condition, upgraded and maintained within the limited budget allocations, and few new facilities are commissioned based on the community needs and available funds. The existing hospitals are regularly reviewed and upgraded under the hospital revitalization plan to meet the challenging needs of the communities. All facilities, some more than others, need further improvement in physical structure and equipment, especially Chairperson, here we are talking about the seclusion rooms that are needed within our facilities for 72-hour observations. Some they don't really meet the standards of the healthcare system. A priority has been given to establish a fully functional mental health care directorate. Currently, personnel has been assigned as an acting senior manager, community-based mental health services, adolescent and substance abuse and support services. The vacant posts in the proposed structures of the mental health directorate, we are going to be prioritized in the financial year 2022 and 2023. There are 2 effective mental health care review boards in the province. The other one serves the metro and the northern part of the Free State, while the other one serves the eastern Free State. The Free State Psychiatric Complex is the only specialized psychiatric hospital that we have in Free State, and it is designated in terms of the Mental Health Care Act 17 of 2002. It is also designated as care and rehabilitation center for persons with severe and profound intellectual disabilities. Admission, care and observation services for persons referred by a court for psychiatric observations, as well as the treatment. Rehabilitation for state patients and mentally ill prisoners under the Criminal Procedures Amendment Act 65 of 2008. These are the services that are found in our Free State psychiatric complex in the Free State. We have an allocation of beds for Free State psychiatric complex as follows. The forensic unit has commissioned 144 beds, but presently in use is 120. Observation unit, we have commissioned 20, presently in use is 15. Acute psychiatric is 68, presently in use is 60. Long-term units is 120, presently in use is 90. Psychogeriatric unit is 55 and 55 are in use. Care and rehabilitation units 470, 420 are in use. A total of 877 beds are commissioned, while we use 760 at the moment. The child and mental health care services, the outpatient mental health care treatment and rehabilitation services to children and adolescent services for users are also found here in our psychiatric complex in Bloemfontein. Substance prevention and rehabilitation services, outpatient care, treatment and rehabilitation services of addicted persons to substance who are treatment resistant are also helped here. These are the outpatients that are helped in our facility, this psychiatric health complex that we have. Adult outpatient services, the outpatient care, treatment and rehabilitation services of complicated or treatment resistant adult mentally ill service users. The district support services, that is the outreach services that are given to our peripheral healthcare services. Multidisciplinary team outreach to regional hospitals, some district hospitals, designated CHCs, and some identified clinics. We have a 24-hour telephonic consultation that is licensed services, support of the district health facilities in a form of telephonic consultation between the health professionals, that is would be the medical practitioner in the community with the specialists at the FSPC, that is Free State Psychiatric Complex. that would be in the form of psychiatrists. The contract appointment of clinical psychologists and registered counselors. We have in order to improve the access to quality services to all eligible people with mental health problems, we have appointed clinical psychologists and registered counselors. And which these people also assist us in trying to deal with the psychosocial problems, especially at the time of COVID, where many people were affected mentally because of the infection of COVID and also the quarantine period. The Boitumelo Regional Hospital has 47. We've got 2 regional hospitals which where we have commissioned beds for inpatients. That is Boitumelo Regional Hospital and Mufumadi Manapo Mupedi in Kwakwa. The Boitumelo has 47 commissioned beds and Manapo has 30 commissioned beds. The services that are provided here is provision for inpatient care to voluntary assisted and involuntary patients, the 72-hour assessment, the emergency and further involuntary care, the treatment and rehabilitation, providing designated detoxification sites for the substance abusers, provision of secondary level outpatient services, a referral of complicated and treatment-resistant cases to tertiary level, the down referral with proposed management plan of patients that may be managed at primary level, provision of support to the district hospitals in fulfilling their responsibility in terms of mental health care through the structured outreach program and telephonic consultation services. Because there is a research that was done that the mental health care users, it is indeed helpful if you treat them together with the family so that the family accept the mental health care users easily. They don't really neglect them. The 29 facilities listed there, we've got 29 facilities that deal with the 72-hour assessment. And here the services that are provided is that it is in an outpatient care and treatment of patients managed at the primary health care, provision of 72-hour assessment, referral of complicated treatment and resistant patient to secondary level services, support to district clinic in fulfilling their functions in terms of mental health care, and the implementation of patient management plan prescribed by the practitioners. The community mental health care services, we've got 16 compliant NGOs that are registered with the Department of Social Development, the NPO, and are licensed by the Department of Health to take care of our mental health care users. Provision of residential accommodation and community-based services to 17 psychogeriatric and 15 adult mental health care users. Monitoring and support visits to the above-mentioned NGOs, providing, this is what the department does, we monitor and support visits to above-mentioned NGOs, providing—
As you conclude, honorable member, as you conclude.
As I conclude, yes, providing psychogeriatric and adult community-based mental health care services is done yearly according to the Mental Health Care Act number 17 of 2002. We believe that there's still more that needs to be done for the mental health care patients. Because we have seen that it is indeed one of the burden of the diseases. And now that we are already seeing many of our people committing suicide, this is one of the things that we really are going in this financial year, going to focus on it and to work very hard in order to help our people to deal with their problems without really thinking of suicide as the only way out. Thank you, Chair.
Thanks very much, honorable member. Honorable members, I'll continue with the speakers list. Before, I would like to welcome our 2 members that have joined us in the NCP. You are welcome, Honorable Mama Rabel and Honorable Khatebe Bungan. Honorable members, the next speaker is Honorable Christians. Honorable Christian.
Thank you, House Chairperson, Honorable House Chairperson, Honorable Deputy Minister, Honorable members and fellow South Africans, good afternoon. Mental health is being treated as an insignificant part of the health sector in South Africa. And sadly, this has been to the detriment of those who live with mental illnesses. This irreverence towards mental health is reflected in the lack of investment and limited government contribution to mental health. Last week was Teen Suicide Prevention Week, emphasizing the severity and concern for mental health challenges facing our youth. Statistics show that suicide is the second most common cause of death among people aged 15 to 29. The youth in South Africa is especially susceptible to mental health challenges because of the many social issues plaguing the country, also noting that 9% of all teen deaths are due to suicide. 59.5% of youth in the country are unemployed. And research predicts that the risk of suicide in the unemployed is elevated by 20 to 30%. This is further exacerbated by the fact that only 3 of the 9 provinces at the start of the COVID-19 pandemic had child psychiatrists working in the public sector. Additionally, schools in South Africa are no longer a safe space for our children, as they face further threats to their mental health by being called derogatory names, face fears of assault, bullying, and exclusions from activities by their peers. It is therefore a huge concern that there are limited youth-friendly mental health care and services in the country where the youth are overwhelmed by so many difficulties. People are stressed, anxious, and grieving. Suicides have escalated, and it is imperative that depression is treated with love, compassion, and appropriate intervention. Lockdowns and subsequent losses, whether personal or financial, have amplified depression. In a severely unequal society like South Africa, the virus exposed existing mental health care services, as well as the shocking public health crisis in the country. This raises the critical question: who does the responsibility fall on to remedy the lack of counseling resources in the country? Research shows that prior to the pandemic, 1 in 6 South Africans already suffered from anxiety, depression, or a substance use disorder, with 60% of people possibly dealing with post-traumatic stress. However, just 27% of South Africans with severe mental disorders receive treatment. The same paper reflected that in 2019, just 5% of the national health budget goes to mental health, and only 50% of public hospitals with mental health services actually have a psychiatrist. To add fuel to the flames, it is estimated that when crime and motor vehicle accidents are taken into consideration, up to 6 million citizens in the country suffer from stress-related disorders. The truth is that people don't know where to get help or are too scared to seek it. And with the limited statistics, it is clear that the state of the country's mental well-being is in severe crisis. The South African Depression Anxiety Group claims that less than 16% of sufferers receive treatment for mental illnesses. And although over 85% of these patients are dependent on public health sector services, there are only 18 beds for every 100,000 people available in such hospitals. And only 1% of these are reserved for children and adolescents. It is no secret that only a minority of gender-based violent cases are reported. This includes the incompetent and unjust handling of gender-based violence cases in the justice system, as well as abuse and harassment of survivors by perpetrators. This further marginalizes women and children, increasing their susceptibility to mental health problems, once again leaving the most vulnerable, women and children, at the mercy of an ailing health system. The responsibility that falls to community health providers when it comes to dealing with mental illness is huge, and the lack of a sustainable funding model for mental health perpetuates the lack of mental health services, as there is no clear source of funding for the implementation of policies and plans. This is an indication of the lack of empathy for mentally ill people and exposes the inadequacy and paucity of mental health care services in the country. Mental health requires a focused, assertive response by government, and services should be at the forefront of this task. Access to mental health facilities should be prioritized. Government should ensure that facilities and mental health practitioners are adequately equipped. Employ more psychologists at strategic points, such as hospitals, clinics, and schools. Place the hundreds of social workers who to date have not been employed so that communities can be alerted, cases reported timelessly, and help given to those who need it. Mental health needs to be integrated into the school curriculum with emphasis on bullying and safety. Mental health is something we should work on continuously as part of our regular health routine. The more we talk about mental health, the more we will see it being made a priority in our workplaces, our communities, and our lives. Thank you.
Thanks very much, Honorable Member. Honorable members, the next speaker is Honorable Honorable Gauteng MEC for Health, Honorable Mohetti. Honorable Mohetti.
Thank you very much, Honorable House Chairperson, Honorable Winnie Ngwenya, the Chairperson of the NCOP, Honorable Masondo, Deputy Chairperson of the NCOP, Honorable Lucas, Deputy Minister, Honorable Dr. Romo, MECs present here, honorable members of the House, distinguished guests, fellow South Africans, Sanibonani. Good health is a significant precondition for sustainable development of society, and mental health is a key aspect that hinges on human health in general. Mental health comprises of various mental conditions. It includes social, psychosocial, and emotional well-being. It also affects the manner in which we think, we act, and the manner in which we feel. Mental health assists to determine how we handle depression, how we relate to other people, and the way we make individual choices. It is an important feature at every stage of human existence, from childhood, adolescent, and throughout adulthood. The World Health Organization have previously published various reports indicating that throughout the world, people are affected by mental health disorders at a very alarming proportion. The reports further illustrate that mental health condition and psychoactive substance-related disorders are highly prevalent and are the main contributors to disability, morbidity, and premature mortality. Although in many instances, investment in suitable and evidence-based treatment remains extremely limited, and many people experiencing mental health conditions suffer grave human rights violation, stigma, and persistent discrimination. In recent years, there has been growing concession regarding the essential role mental health plays in attaining global development goals, and this is well articulated by the UN Sustainable Development Goals of 2019. Honorable members, the advent of COVID-19 global outbreak almost 2 years ago has intensified the risk factors commonly related with poor mental health attributed to unemployment, financial insecurity, anxiety, and depression, amongst others. This has resulted to an unprecedented worsening cases of mental health challenges in our communities. While the novel coronavirus affected South Africans in general, the poor suffered severely as a result of poverty, unemployment, and structural socio-economic inequality. In light of the above, Gauteng Department of Health has been preoccupied with the provision of efficient mental health services through giving priority and maximizing access to mental health facilities. The unfortunate circumstances that led to the Life Esidimeni tragedy will always be used as a deterrence and a constant reminder to treat mental health issues as an apex priority. Subsequently, the Gauteng Department of Health established a task team called Mental Health Technical Advisory Committee to provide guidance regarding the implementation of the Health Ombuds recommendations and to develop a mental health recovery plan. According to that plan, Gauteng Province Mental Health Strategy and Action Plan 2019-2023 was developed, and it made strong emphasis on making mental health care broadly accessible. The plan also incorporated a strategy to reinforce district mental health services to successfully provide community-based care for people with various types of mental health conditions. This is consistent with the international human rights and South African legislative framework and policy directive. Similarly, the strategy involved an organogram with 3 new human resource teams incorporated into the district health system. These are teams with high level of assignments. The first one is a district specialist mental health team tasked to develop a public mental health approach. The second team is a clinical community psychiatric team for services delivery within the primary healthcare level. And the third one is the team to support non-governmental organizations with governance and compliance matters, including the support of community-based mental health care needs. 3 district-based mental health teams also work with hospital, primary healthcare or clinics, NGOs, non-health governmental sector, and multiple community-based stakeholders whose mandate is to provide preventive and international mental health care. They also provide effective collaborative and supportive interactions with every stakeholder in the mental health fraternity. Henceforth, as Gauteng Department of Health, we now have a community mental health services that involve mental health promotion, which is a patient-centered and recovery-oriented therapeutic services that fosters integrated physical and mental health care. In addition, we ensure that we direct substantial resources within the limitation of allocated budget in order to strengthen all levels of care. The Gauteng Department intends to continue to uphold our constitutional obligations, including the United Nations principles for the protection of persons with mental illness and the improvement of mental health care. The Gauteng Department of Health is currently in the process of strengthening the Mental Health Care Directorate, which is a key champion for oversight and support of the implementation of the Gauteng Province Mental Health Strategy and Action Plan 2019-2023, which is a key outcome of the recommendations of the Health Ombuds post the Life Esidimeni tragedy. As part of the department, we remain committed to render a quality mental health care. Chair, am I
protected? MEC, continue.
Thank you. We have prioritized the key areas that are catalysts in ensuring that we transform the manner in which we provide services. The following are our infrastructural facilities to continue to improve access to mental health care for all members of the community. 4 central hospitals, Charlotte Matleke at 50% functionality, the 3 tertiary hospitals, 4 specialized mental health care hospitals, 25 hospitals, regional and district hospitals, plus 300 clinics inclusive of 34 CHCs. We are also mindful that there are insured members of our communities that have access to various mental health care facilities in the private sector. Our long-term vision is to ensure that quality public mental health services are accessible, comprehensive, equitable, and integrated at various levels of healthcare system as guided by the National Health Act 61 of 2003 and the Mental Health Care Amended Act 12 of 2014 and all applicable regulations, including Sustainable Development Goals from the World Health Organization. This is compatible with the ongoing programs with the broader healthcare transformation process currently being implemented in our country. This includes the processes of implementation of national health insurance, restructuring and enhancement of primary healthcare, human resource development and infrastructure revitalization for healthcare. Honorable members, we remain faced with historical challenges that continue to torment our society. This includes persistent and extreme levels of mental disorders associated with social elements such as unemployment, poverty, substance abuse, violence, and other hardships that increase exposure to individuals to distressing mental conditions. For us to achieve the mental well-being of all individuals in our society, there must be a collaborative effort from all sectors, including political, socio-economic, health spheres, civil society organization, educational sector, and faith-based organizations in order to implement a positive intersectoral intervention program to address the lingering social anomalies. Mental health care and wellness is a responsibility for all of us in the interest of wellness of every community in Gauteng and South Africa in general. As Gauteng Department of Health, our aspiration is to create a conducive environment for a long and healthy life of our citizens. We are engaged in the health expedition to successfully reduce extensive burden of untreated mental health disorders. We must reach good and reasonable levels of mental health care wellness for all citizens in the interest of the safety, survival, and recovery from COVID-19 impact. As I conclude, Honorable House Chairperson, the attainment of decent mental health in our society has prospects of contributing sustainability to social and economic development. We need to treat this pertinent subject with the kind of agency it deserves. While we're still fighting to restrain COVID-19 global pandemic, we must not lose track with other health priorities areas which over and above the pandemic, we must leverage to improve the healthcare outcomes. The Gauteng Department of Health remains steadfast in our obligation to transform, improve, and sustain the access to quality healthcare, to quality mental health care provision for all citizens in the Gauteng province and the country, because Honorable House Chair, we're also as Gauteng servicing other patients from other provinces and in the SADC region. I thank you.
Thanks very much, MEC Mukherjee. The next speaker is Honorable Ndongeni, ANC. Honorable Ndongeni.
Thank you, Chairperson. Honorable Chairperson of the Council, Deputy Chairperson, Deputy Minister of Health, all MECs in the platform, SALGA representatives, Chief Whip, members of the Council, fellow South African, molweni ngalemva kwenini. Drugs and substance abuse are a major social ill, which has resulted in many South Africans' lives being distracted. The state of our security system as a nation has a pivotal role to play in fighting this deadly scourge of drug abuse. The fact that drug trafficking in our country and the fact that our policy-based drug-making labs show the prevalence of drug in our communities. Drugs have led to a lot of pain for families and communities. These drugs are making their way to our schools, which is also alarming. Another concern phenomenon is the abuse of alcohol, which has become prevalent amongst the youth. Alcohol and drugs abuse are not only harmful at the level of one's life, but also has a negative impact on one's health. As a nation, we need to ask ourselves critical questions on this scourge, which also a contributor to mental health, depression, and other socio-economic deprivations, which the majority of youth and marginalized South African experience. This also contributed to the suicidal thoughts and violence in the society. The problem of drug abuse and substance abuse is not based on the race, class, or gender, but it cuts across It is also important to note that despite it being a broad societal problem, it has more gross implication for the poor. As a society, we should also assess whether we are assisting users of drugs in addressing substance abuse, or when we have knowledge of drug dealers who are destroying the youth crystal meth and nyaupi, we cannot be silent. Normalizing drug trade and not addressing this challenge as a community will further exacerbate the prevalence of substance abuse in our society. Children are largely influenced to start consuming alcohol or drugs based on observation, which can be within the family or in the community, or through being peer pressure by friends. Social media and other media platforms are also another key social influencer, which normalize abuse of alcohol and drugs through projecting them as fashionable and also due to the influence of celebrities. Alcohol consumption and association problems vary widely, and the burden of alcohol-related disease and death is significant in most countries. It is thus imperative that we ensure that government working with civil society should continuously create awareness on the danger of substance abuse and their impact on mental health. The expansion of awareness campaigns from the security cluster, social development, and Department of Health, the Department of Communications, the Department of Sports, Arts and Culture, the Department of Education, and the Department of Higher Education should develop a coherent and cogent plan which draws from the various capabilities of the departments to fight this scourge of substance abuse. The Department of Communication, through its communication entities such as the SABC, should be able to develop media content which continuously campaign against the abuse of alcohol and the use of their drugs. Through TV and radio and the social media platforms and developing a framework for content creators, government can surely begin to create much needed awareness for a positive influence to the people of South Africa. The Department of Basic Education and Higher Education is also a major component of socialization, and it is therefore imperative that the education curriculum and schools and campus awareness programs always create the awareness on the destructive impact of alcohol abuse and drug use. As much as we condemn abuse of substance, it is critical that society, family, friends, religious leaders, and civil society extend their hand to help South Africans who have become addicted to alcohol and drugs to stop abusing substance and refer the counseling and rehabilitation service within their communities or their nearest rehabilitation centers. This is a major societal task, or if we are to reverse the growing incidence of the mental health, which also contributes in inducing criminal behavior, depending on the context. Rehabilitation is one among the interventions which we need to create more awareness in our communities, to normalize them so that they are not stigmatized. Honorable members, our task working with the people should be answering and acting on the question of how we can create drug and substance-free society through sports, recreational activities, and educational and work opportunities. The Department of Sports and Arts and Culture plays a critical role in ensuring that the youth do not have time to loiter in the street, but to be involved and engaged in sport. Those with creative skills, the department should be able to expand its support to artists at the ground level. The Department of Police are one of the critical levers which should have a specific focus on drug trafficking in our country, because it is a casual factor for many of the social ills which we experience in our society and mental health challenges faced by many. We need to strengthen the fight on now sides of drugs trade, working with our people. The Community Policing Forum should also focus on fighting drugs trade. The implementation of the National Drug Master Plan is critical in the fight against drugs. The National Drug Master in a country strategic document to guide stakeholders on measures to combat alcohol and other substance of abuse in the country. South Africa has adopted a drastic change in approach to drug policy. Government has embarked on evidence-based public health and social justice principles. The following drugs are popular in South Africa: alcohol, cannabis, tobacco, white pipe, and nyaupe stroke wunga. It's important for South Africans to understand this fact that addiction is a disease that affects the brain and behavior to assist us to understand drug use and the appropriate response. Addiction is defined as a chronic, relapsing brain disease characterized by compulsive substance seeking. Despite the harmful consequences, repeated use of drugs can change the structure of the brain over time, change the way the cells normal function, send, receive, and process information. Government remain resolved to tackle the scourge of alcohol and substance abuse in South Africa. In this regard, the Department of Social Development established the Center Drug Authorities, a multi-sectoral forum for tackling the scourge of alcohol and substance abuse. The evaluation report of the implementation of the National Drug Master Plan reflects that the low financial allocation for the CDA is a weakness on the impact of CDA should have a relation to implementing the National Drug Master Plan. Mental health impact is not irreversible, but can be addressed depending on its nature. We need to continue mobilizing our society to protect our communities, children and youth from this trap of abuse of substance, as it has a direct impact on their mental health. I thank you, Chairperson.
Thanks very much, Honorable Ndongeni. The next speaker is Honorable Lutuli, EFF.
Thank you, Chairperson, and ngibingelele wonke umuntu. Ngaqhubeka, Chairperson?
Yes, ma'am.
Okay. Ngibingelele wonke umuntu okhona. Chairperson, isikhathi eside lapha eNingizimu Afrika, abantu abanokugula ngokwengqondo baphathwa sengathi abasiyona ingxenye yezempilo, lokho okwenza izimpilo zabo zibe sengcupheni. Under the COVID-19 lockdown period, South Africa's mental health has worsened as lockdown has proved to be a devastating time for our country. Hlalo izinto zemapeketwane. Ukuqhubeka kwe-lockdown kwenze kwaba nokungahlaliseki kahle ngenxa yokungabi khona kwezindawo ezanele zalabo abaphila nesifo sokugula ngokwengqondo. Ours is a society which is experiencing increased level of gender-based violence and femicide. The past year alone, our country experienced unprecedented level of poverty and inequality as the unemployment rate rises with every quarter. The lack of hope for our future causes anxiety among our youth. Protest marches and civil unrest have become an everyday lived reality of our people. Our current socio-economic issues and political unrest are enough reasons for increased level of stress and anxiety in South Africa. We live with an ever-present fear of crime, trauma, and violence. There is a lot to bear, Chairperson, and it can be crippled for our mental health and well-being. Our people are being diagnosed with depression as they are impacted by the pandemic on a daily basis, both directly and indirectly. Our people are stressed. They are anxious and grieving as a result of everyday challenges, which they are forced to live under. And research shows a direct link between depression and suicide. Abantu bethu bahlukumezekile, futhi basezinhlungwini, Chairperson. While there exist many reasons for South Africans to be experiencing a decline in their mental health, there are not enough affordable healthcare solutions to help those in need. In South Africa, there exists lack of resources in the mental health sector. Resources required to deliver mental health services are inadequate, particularly those dealing with child and adolescent mental health services.
We are faced with a shortage of mental health practitioners, and there is a need for additional training, so much so that the burden of mental health care is placed mainly on the shoulders of community-based providers in clinic. Support groups and counselors are having to step in and intervene in situations where institutionalized help is not available. Labo abagula ngokwengqondo uma bedinga usizo abalutholi ngenxa yokungabi khona kwabahlengikazi abaqeqeshelwe lolu hlobo lokugula okwenza bagcine be misdiagnosed and possible relapse of mental illness. The situation is much worse in rural areas where there exist no mental institutions. Stigma and discrimination against people living with mental illness is widespread, which poses a major stumbling block to treatment. Many of our mental ill are roaming the streets. The Black communities there exists a lack of awareness of mental illness. Mental illness is not viewed as a real illness, and at times suffers a discrimination against, and they are being disowned by their own families, or even fired from work should they admit to have a problem. People with mental health problems are often exposed to gross human rights violation, severe discrimination, and inadequate housing and nutrition. So much so that when an elder woman experiences mental episode, they are often called names and accused of witchcraft. And the hulumeni wethu uyabuka nje and akenzi lutho. At institutional level too, gross inhumanity towards people with mental illness occurs. The life as a Dimene tragedy bears testimony to the lack of empathy for mentally ill people and the neglect of mental health services. Due to the cruel and inhuman decision of the Gauteng Department of Health, 144 patients with mental health problems died in undignified conditions. Over 1,400 surviving patients were exposed to torture, trauma, and severe violation of their human rights. This all because mental health care patients were referred from a state facility to unregistered and unsuitable non-governmental hospital. The life as a Dimene tragedy was an avoidable tragedy, which will always stand as a testimony of the way in which our government treats the most vulnerable of our people. There is still a long way to go to improve access to quality mental health care. The COVID-19 pandemic laid bare existent mental health care service gap and the crisis that is our public health system. There still exists a need to develop appropriate mental health policies and laws, but also the actual implementation of such policies. Mental health needs to be at the center of police framework and national strategy. Our budget priorities of a provincial level still stands a key barrier. There is a need for improved financial investment at a local level in order to increase access to mental health. Medical and non-medical interventions are needed in order to strengthen our health system so as to address the large treatment gap for mental disorders. Mental health literacy needs to be made a priority. We need to eliminate stigma associated with mental health and promote a culture of acceptance. However, this has proven difficulties to achieve under the leadership of the ruling party, as there is a lack of leadership required to undertake this simple task. Instead, inequality, crime, gender-based violence, and the neglect of our most vulnerable in society thrive on the back of corrupt and mismanagement. The ruling party has demonstrated that they have no clear strategy to deal with the mental health. I thank you.
Thanks very much, Honorable Bituli. The next speaker is Honorable S. Matota. Northwest MEC.
Balibongwe.
Honorable Matota.
Chair, I'm not Honorable Matota, I'm Honorable Sambata. It's M Sambata, not S Matota. Thank you very much, Chairperson. It's a mistake.
Sorry, MEC.
It's a mistake. It's a mistake, Chair.
Honorable S.
Matota, no, it's a mistake, Chair.
I'm sure now we bonil.
Yes, Libonile, Chair. Thank you very much, Chairperson. Chairperson, Deputy Minister of Health, members of NCOP, Chair of Select Committee on Health, and my colleagues, MECs, and everybody. Thank you very much for this opportunity. The World Health Organization concedes that there has been increasing acknowledgement of important role mental health plays in achieving global developmental goals, as illustrated by the inclusion of mental health in the Sustainable Development Goals. As I said, this calls for member states, including our country and provinces, to seriously engage on impactful programs to deal with mental health challenges. That is why it is important to commend the NCOP for heightening the mental health program, putting it in the debate of today. A democratic government led by the African National Congress saw it befitting to correct the state of mental health in the country, which was in adverse state pre-94. It is well documented, Honorable Chair, that pre-94 mental health services were primarily disintegrated and alienated from the broader healthcare system of the country. South Africa therefore made a paradigm shift to integrate mental services into mainstream health sector. The theme which guides the debate, namely mental health for all, giving priority and greater access to mental health care for all, is a measuring stick by which we can establish how far we have come in ensuring that our communities have access to mental health. While much has been achieved, there are still many challenges that need to be tackled in order to realize the vision contained in this theme. One of the indicators under the objectives of universal health coverage through National Health Insurance Fund is mental health visits to health facilities for persons 18 years and older. In this case, the Northwest Province has seen 95,582 persons during 2020-2021 cycle. The majority of these people, 36,180, are in Bujanala district, followed by Dr. Kenneth Kaunda, Dr. Nakamudiri Mulema, and Dr. Ruth. For persons under 18, Honorable Chair, the province's facilities have seen 9,724 people. In this age category, Dr. Kenneth Kaunda is leading with 4,673, followed by Bujanala 2,990, Nakamudiri Mulema 1,526, Dr. Ruth 535. The province also recorded a total of 408 mental health involuntary admissions during the same period. Mental health services in the province are provided in line with the Mental Health Care Act number 17 of 2002 and its regulations, as well as National Mental Health Policy Framework and Strategic Plan 2013-2020 and other relevant policy perspectives. The province has 2 specialized mental hospitals, Honorable Chair, against the target of 2. These are Bupilong Provincial Psychiatric Hospital, Veteran Hospital. We also have 2 designated mental health units in general hospitals against a target of 2. These are Taung District Hospital, Job Shimankane Provincial Hospital, as part of broadening access Tsepong Hospital and Mafikeng Provincial Hospital have provisions for 72-hour observation. The Northwest Department of Health issues licenses to private hospitals to render inpatient mental health services. These are currently private facilities are Beethoven Private Hospital, Multi-Care Hospital in Port, ParkMed Hospital in Klerksdorp, Gatelo Pili Wellness Center in Mahikeng. The province has also achieved the target of rehabilitation centers for substance abuse, which are 3, and they are in JB Marks Rehabilitation Center in Port, Social Development Center and Sun Park Private Rehabilitation Center in Klerksdorp, White House Rehabilitation in Rustenburg. Mental health services are integrated into the primary care services. We have ensured that primary care services for mental care health are provided as an integral primary health care in all 18 sub-districts of the province. The services at this level entails visit from patients who are either discharged from hospitals to community care or initiated on treatment within primary health care. In terms of bed distribution by specialty, at Vedrand Hospital, we have a total of 982 beds with 851 used. For Bupilong, we have 384 beds with 234 in use. Designated units, Honorable Chairperson, in general hospitals account for a total of 80 beds, which at the 72 observation units account for 76 in total. The province has quality assurance mechanism for mental health. For mental health in all designated licensed facilities, including hospitals. The province has 2 mental health review boards, which are appointed according to the Mental Health Act requirements. The boards are composed of 4 persons that include a legal person, 2 mental health care practitioners, and 1 community member. The review boards contribute to the quality service provided by reviewing documents and records, conducting oversight on mental health facilities across the province. The Provincial Inter-Sectoral Committee was established in October 2019, led by the Department of Health and consisting of the following departments: Social Development, Education, Correctional Service, South African Police Service, and the Justice and Constitutional Development. Infrastructure remains the challenge. Is my time up, Jen?
No, it's not. It's not. It's not.
Okay. Infrastructure. Thank you very much. Infrastructure remains a challenge and limiting factor in increasing number of beds. However, there's a plan in place for this. The designated 72-hour facilities have been prioritized for maintenance and refurbishment, and they include Taung District Hospital, Klerksdorp Tsepong, Buitikong, and Job Shimankane Tabana Hospital. Plans are underway to increase capacity of Bupilong Psychiatric Hospital beds. Patient-related factors like non-compliance to treatment aggravated by poor family support remains a challenge. The department remains committed to the strengthening community-based mental health in the next financial year. The mental health human resources challenge is largely a result of difficulty to recruit and retain psychiatrists and psychologists, and registered counselors are in demand across the country due to the rural nature of our province. The department, however, continues to work in collaboration with training institutions in order to address this challenge. I appreciate our collaboration with various stakeholders, and I believe that if we can continue as a department to work together to address the challenges, Then our vision of mental health for all, giving priority and greater access to mental health care for all will be realized. Thank you very much, members and the chairperson. Thank you.
Thanks very much, MEC. Your surname has been corrected. You are MEC M. Sambata. Siyabonga, MEC. Honorable members, we are continuing with our speakers list. I'm now going to call Honorable De Bruin and invite Honorable Jay Nyambi to continue with the program. Siyabonga. Honorable De Bruin.
Thank you, Honorable Chair. Honorable Chair, as stated by members today, we all know the impact of the COVID pandemic on the mental state of South Africans was tremendous, as well as the unfavorable socio-economic circumstances our citizens face each day. Through studies and countless reports, we know that more and more South Africans fall victims to one or the other mental disorder yearly in the past decades. It is also a well-known fact that psychiatric institutions across South Africa are severely understaffed and ill-equipped and simply doesn't have the infrastructure and the capacity to deal with the growing demand of mental disorders. Wat skokkend is, agbare voorsitter, is die feit dat die regering vir dekades reeds al bewus is van hierdie feite, maar steeds geen daadwerklike of konkrete plan ter tafel kon lê om hierdie situasie op te los nie. Sekerlik was daar rooi ligte in 2013 toe die psigiese gesondheidsbeleid raamwerk en strategiese beplanning op die been gebring is met die belofte dat daar teen 2022 verbetering en verligting in hierdie verband sou wees. Maar soos oudere gewoonte en tipies onsuksesvolle ANC-projekte is daar ongelukkig geen vrug van sukses gewerk nie. Inteendeel was daar nie eers gepoog om die tydperk van hierdie projekte verleng om die tekortkominge daarvan reg te stel nie. En die tyd het eenvoudig net verstryk en dit is daar gelaat. Selfs na die uitbreek van die COVID-pandemie, wat talle mense as gevolg van bykomende druk weens finansiële onsekerhede, isolasie en toekomsonsekerhede geestelik verwelk het en daar 'n skerp toename in selfdoodgevalle, alkoholmisbruik en gesinsgeweld was daar geen nuwe poging of selfs net beplannings gedoen om die psigiese gesondheid van Suid-Afrikaners te verseker nie. Die meeste, indien nie al die psigiatriese sentrums en hospitale onder staatsbeheer, is in haaglike toestande met vervalle infrastruktuur, 'n tekort aan toerusting en opgeleide personeel. Die gevalle van aanranding en mishandeling van pasiënte in hierdie instansies is skokkend en die algehele higiëniese toestande is kommerwekkend om die minste te sê. En ek wonder wanneer laas ons minister en die LER hulle self verwerdig het om hierdie instansies te gaan besoek om eerstens te kan sien wat die omstandighede daar is. Surely the department must realize that 18 beds in mental institutions per 100,000 citizens in South Africa is inadequate to say the least, or that 0.04 psychiatrists per person institutionalized in South Africa is unacceptable, and not to mention the shameful budget allocations to mental health, seeing as 1 in 6 persons in South Africa suffer from some form of mental disorder. The fact is, Honourable Chair, the department and the government do realize these facts and challenges. The problem, however, is they simply do not care enough or have the political will to make a real difference. So for the sake of every South African, I plead that the Department of Health takes responsibility and ensures sufficient budgets, equipment, staff and training for mental health as a whole in South Africa. And please don't continue to forsake the mental health of our people. Thank you.
Thank you. Thank you, Honorable De Bruin. I'll now invite Honorable Philander from the Western Cape. Honorable Philander.
Thank you very much, Honorable Chairperson. According to the World Health Organization, depression is the leading cause of disability worldwide. Moreover, it is considered to be a major contributor to the overall global burden of disease, in which 5% of all adults are affected, with women being the worst off. It has also become abundantly clear that COVID-19 has worsened the pre-existing challenges we see in South Africa. In 2020, our country ranked 103rd out of 149 on the Happiness Index, a measure of population well-being derived from 6 factors: the GDP per capita, social support, healthy life expectancy, personal freedom, the goodwill of others, and trust in the government. The COVID-19 crisis has also further heightened the risk factors generally associated with poor mental health. financial insecurity, unemployment, fear, employment, and educational engagement, access to physical exercise, daily routine, access to health services. All of this has led to a significant and unprecedented worsening of population mental health. In every country, the decline in mental health has been directly linked to those experiencing financial insecurity, a trend that predates the pandemic, but seems to have accelerated in many cases. And dear Chairperson, we find ourselves asking the same question for the past 3 years. What is South Africa's decisive efforts to scale up mental health services, and what are the measures that the South African government has put in place to protect jobs and incomes? The scale of distress since the start of the pandemic requires a whole of society approach to mental health support. High-risk groups are those with greater mental health problems, including women, youth, and poorer people. In their concluding observations on South Africa in 2018, the UN Committee on the Rights of Persons with Disabilities expressed grave concern regarding the rights of people with psychosocial disabilities. Our medical model of disability and mental health legislation were criticized. The needs of women and children were emphasized. Chairperson, can I be protected?
You are protected.
Hello.
Honorable members.
How are you?
Honorable members, please, can we mute? You are protected, Honorable Philand, I'm sorry.
Thank you very much, Chair. Our medical model of disability and mental health legislation were criticized, and the needs of women and children were emphasized. As South Africans, we need to change the way we live so that people with psychosocial disability may also live lives of dignity and well-being. The Western Cape Government's recovery plan called on Premier Alan Winde and the province to address the difficult circumstances that people of the Western Cape are confronted with. This speaks to a caring government that, notwithstanding the ever-increasing budget constraints, still needed to assess the great need among all Western Cape residents and to face these challenges head-on. This plan reflects the latest research and the impact of COVID-19 had on society. As such, we are able to prioritize those interventions outlined in the provincial strategic plan in order to maximize the positive impact on crucial matters affecting our residents. The Western Cape Government outlined 4 themes in the recovery plan. In terms of COVID recovery, in the midst of the pandemic, existing health services continue with a great focus on implementing improvements. In terms of jobs, the economic impact of COVID-19 has been severe. Recovery is only possible when our economy grows and our citizens are able to generate an income once again. In terms of safety, which is linked to well-being and cannot be achieved if basic human needs are not met. In terms of well-being, the realization of basic human needs of all citizens as reflected in our Constitution. Chairperson, for us to be the change, government needs to comprehend what life was like pre-COVID and the impact it has on everyday life moving forward. Quality care must be accessible to all in order to positively impact the lives of all South Africans. Through you, Chairperson, the ANC-led national government has failed our nation dismally during a time in which we needed a caring government to put South Africa first. The South African Social Security Agency reported to the Parliamentary Select Committee on Health and Social Services, Honorable Gillian, that they lost approximately 11 million rand when 31,955 people improperly benefited from the COVID-19 social relief of the stress grant. This is the grant that was aimed at providing assistance to persons in dire material need that were unable to meet their family obligations, their most basic needs. To this day, we wonder what actions have been instituted against government employees who unlawfully benefited from this grant, and we know nothing as usual. I've dealt with factors, Chairperson, concerning and impacting every citizen in this country. And it is once again the Western Cape, which is the only province that has actually dealt with these factors. National government neglect through incompetence and thievery has left no room for the state to even consider the mental health treatment gap in South Africa. As with most things in South Africa, while public policies exist, it fails to be implemented. It is only in the face of tragedy that we saw the strengthening of mental health care after nearly 150 patients died after being moved from the Life Esidimeni Hospital to unlicensed facilities in 2017. And as mentioned, Chairperson, by the Deputy Minister Dlomo today, regulations are being concluded 5 years later, Chairperson. Yet again, these experiences speak to a failing national government. The National Health Insurance Act, which the ANC persists on pursuing, has already shown inconsistency with the strategic plan and its limited integration of mental health as a priority into the system. South Africa spends 5% of the total health budget on mental health services, equivalent to the lower end of international benchmarks of the recommended amounts countries should actually be spending on mental health. Right now, there is an alarming estimated 92% treatment gap, which means that less than 1 out of 10 people living with a mental health condition in South Africa receive the care they need. This reflects a reactive mental health care system that is focused on treating the most severe conditions rather than preventing or providing necessary early interventions. Chairperson, mental illness is not a death sentence, and most people who experience mental illness will, if given the right support, be able to recover sufficiently to be able to live and to work and to learn and participate fully in their communities. The Western Cape Government Health Department addresses the growing need for care of patients with mental illness by improving access to treatment and counseling at the primary healthcare level. In line with the Mental Health Care Act 17 of 2002, various facilities make provision for admissions and have added support, which is provided by the Mental Health Review Board. In the Western Cape, various outreach initiatives are done together with psychiatric hospitals and mental health professionals, which include psychiatrists, psychiatric registrars, and psychologists who provide care at clinics, regional and district hospitals, and community healthcare centers. And in addition, the primary healthcare also offers mental health services. Chairperson, the Western Cape is a testament of a caring government in action. And the Western Cape remains the only province which is serious about the well-being of all its citizens. I thank you, Chairperson.
Honorable Nyambi, are we still in? Honorable Nyambi?
May I proceed, House Chair?
Okay, thank you. Advocate, can you assist me? Who's the next in my tablet? It doesn't want to open.
The next speaker, House Chair, would be Honorable Adel.
Thanks very much, Advocate Pindela. Honorable Adel, can you please come in?
Honorable Chair.
Please
thank you.
Open your mic.
Thank you. The next speaker is Honorable Hadebe. It's his maiden speech, already has done it in the joint sitting. Honorable Hadebe.
Thank you, Honorable Chair. I'm not sure if I'm audible.
You are audible, Honorable Pungad.
Thank you so much, Chair. According to a 2019 article by the South African College of Applied Psychology, about 1 in 6 South Africans apparently suffer from anxiety or depression. Unfortunately, the high cost of accessing mental health care services means it is simply not an option for most South Africans. Good mental health and wellness are essential for navigating today's world. It helps us handle stress, relate well to others, and generally make choices that are good for ourselves as well as for society at large. The World Health Organization defines mental health as a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. The World Health Organization further emphasizes that good mental health is more than just the absence of mental disorders or disabilities. In South Africa, universal access for all in respect of healthcare, and particularly in these uncertain and devastating times since the advent of COVID-19, in respect of mental health care, remains of utmost importance. Honorable Chairperson, today marks day 701 of South Africa's declared state of national disaster due to COVID-19 and its resultant lockdown. 701 days ago, the world as we know it changed forever, and we have all had to adapt to these changes as best as we can. As a result of forced isolation, social distancing, and house arrest, with the only exception being local grocery shopping, most South Africans faced a lived reality they had never encountered before. Homeschooling and remote work became the norm, and many industries such as tourism were brought to their knees. Millions lost their jobs and to this day remain without gainful employment. Financial difficulties increased and millions could not meet their personal debt servicing costs. Attending of funerals were limited and family members were unable to say goodbye to their loved ones who succumbed to the disease. The psychosocial cost experience because of this is much more difficult to quantify than the economic losses suffered. It remains hidden within the minds of many and much be acknowledged by this government and in particular the Department of Health. The psychological pain and suffering continue to be exacerbated by the fact that we do not yet have a complete solution to the coronavirus. Vaccines remain experimental with no medical liability on the manufacturers in the event of debilitating side effects and in some cases even deaths. Many post-COVID sufferers continue to experience the debilitating effects of the coronavirus long after they have recovered. 10% develop what is known as post-COVID syndrome or COVID long hauler syndrome. This could last up to 2 years and cost a small fortune in respect of medical bills and medication. Symptoms of long hauler syndrome include mental health issues such as depression, anxiety, psychosis, and mania. Treatment for such conditions is simply not currently available for all South Africans. We remain one most unequal society in the world with high rates of mental health disorders even before the advent of COVID-19. Unemployment was high, crime was out of control, and domestic violence was a common occurrence in many families. COVID-19 only added fuel to the fire. Poverty-stricken South Africans remain the collateral damage of a healthcare system orientated towards those who have private medical aid or who can afford the exorbitant cost of seeing medical professionals. The cost of Western medication are also exorbitant in the extreme. The question must be asked as to why this government allows such medical profiteering to occur. And more importantly, why South Africa does not have its own medical innovation and research centers to explore both pharmacological and traditional medical solutions. Is our medical regulator captured by big pharmas? This must be investigated. The IFP remains a strong supporter of the principle of universal health coverage. Every person in our country, regardless of their financial situation has the right to access the quality healthcare services without financial hardships. However, we do not believe that the current proposal by the governing party to create a centralized fund, the National Health Insurance Fund, to procure health services on behalf of the public is the solution. The NHI bill, in our opinion, has serious flaws pertaining to governance aspects, which raises serious questions on the constitutionality of the proposal. Furthermore, the governing party has failed to indicate how our country will be able to afford and sustain this very ambitious project. We cannot continue on this path as we urgently need to address the enormous gap in equality of healthcare provision in our country. We strongly believe that government should first rebuild and invest in existing public healthcare facilities to ensure receive quality, efficient healthcare services. It is also common knowledge that government has paid very little regard to ensuring adequate access to mental health care services in the public healthcare sector, especially in rural areas. This must be addressed immediately, Honorable Chairperson. If we have learned anything from this pandemic, it must be that we are beings with fragile physical bodies and sensitive minds. We must adopt a holistic approach to universal health care going forward, in which mental health care can and must play an integral role. Let us be united in our common humanity and strive towards health care for all South Africans, irrespective of race, color, creed, or economic status. I thank you, Honorable Chair.
Thank you. The next speaker is the MEC of Mpumalanga, Honorable Manzini, MEC of Health.
Chairperson, NCOP, Honorable Amos Masondo, the Deputy Chairperson of the NCOP, Honorable Ms. Sylvia Lucas, Chief Whip and the Deputy Chief Whip of the NCOP, Honorable members of the NCOP, Deputy Minister present here, members of the Executive Council from other provinces, fellow South African. It gives me immeasurable honor to participate in today's debate on mental health, a day after we celebrated the 154th birthday of one of the greatest Pan-Africans to ever live and struggle for social justice and the well-being of Africans, Dr. William Edward Du Bois, who is also respected for being the first African to obtain a PhD from the prestigious Harvard University. Dr. Du Bois was not only a champion of social justice, the overall well-being of Africans, including mental health, but also a teacher on how we should understand and view the world. And amongst other things, he taught us that education is that whole system of human training within and without the school house walls, which molds and development, close quote. I want to make education on mental issues, both formal and informal, the central thesis of my message today. It is important for society to understand and appreciate mental health issues from all angles, especially the causes, impact, and possible ways of overcoming it. It is through educating each other, each and everyone who use in both formal and informal platform, that we can be molded successfully, overcome this scourge of mental illness. Chairperson, I allow me to express extreme glee at the fact that South Africans from different corners are starting to highlight the issue of mental illness as a societal problem, which require our collective might to overcome. And this is also demonstrated by the fact that this August House is having a debate on the mental health outside of the traditional debates, which only happen in July, which is recognized as Mental Health Awareness Month. This is progress. We must commend and build from it a solid machinery that will fight mental illness daily in our communities. As highlighted earlier, that this debate is extremely important for raising awareness and educating about the devastating impact mental health has on society and the general well-being of our population. Experts say there is a very thin line between normal and abnormal behavior, creating a possibility that all of us might have at one point in our lives suffered from mental illness. The magnitude of this societal problem demands that we participate in today's debate, not as philosophers, who Karl Marx argued they have only interpreted the world in various ways. The point, however, is to change it, so we should debate not with the aim of only analyzing and educating, but with the higher aim of producing practical and implementable solutions to overcome the scourge of mental health in our communities. Prof. Karl Seppes, the Dean of Humanities at Wits University, in his inaugural lecture at Wits in 2018, recognized mental illness as a real experience that people endure. He also offered an understanding of it being influenced by society as well as culture. In a simple terms, his argument is that one of the greatest contributors to mental health issues are the things we do daily as a way of living and the value system which guides our action daily. At this point, Honorable Chairperson, I will request you to allow me to elaborate on the assertion by borrowing on the Atlas Society by President Thabo Mbeki when he delivered his fourth Nelson Mandela lecture and argued that we need to change our value system through the NRDP of the soul. President Mbeki argued, open quote, "It is perfectly obvious that many in our society, having absorbed the value system of the capitalist market, have come to the conclusion that for them, personal success and fulfillment means personal enrichment at all costs, and the most theatrical and striking public display of that wealth." What this means is that many in our society have come to accept that what is social correct is not proverbial expression, manner maketh the man, but the notion that each one of us is at excellence a human being, as our demonstrated wealth suggests. This argument correctly locates the contribution of culture and our value system in the high number of mental illness we are experiencing as a country. As we speak today, we have more than 10 million South Africans who are willing and able to work, but are not finding jobs. It also argues that more than half of our population live in poverty. So it is an inescapable reality that many people will suffer from mental health issues as their desires or what appears necessary for them to be considered as human beings is unrealizable and far from reach at the present moment. This drives from the hopelessness and unmatched levels of mental health issues, which at worst results in people giving up and resorting to action like suicide. This is a clear demonstration of how a corrosive culture and value system drives people into mental health issues. As part of educating society about mental health issues, we must reaffirm our original value of Ubuntu amongst our people, which is anchored on a value system which say you are human by making valuable contributions to society and the progress of humanity, and not by the depth of your pocket or design clothes that you wear or your car that you drive. The new normal COVID-19 has not only affected the country economically, but also in terms of a lockdown on the strategy to curb this spread, but it also presented us with a new spike in mental health illness as an after effect, as most of the people lost their income and those that have to isolate develop some form of mental health care problem, which included depression and anxiety attacks healthcare. Healthcare workers also suffered from mental and psychosocial well-being. Hence, as a department, as a province, we try to make sure that most of our healthcare workers, our frontline workers, we support them so that as much as they are assisting our people in terms of the COVID-19, they themselves are also looked after. This has highlighted the much needed focus on mental health care and for us to pay careful attention to those that suffer from mental health. The recent release of the South African Human Rights Commission report on the status of mental health service on the 28th of March 2019 should cause all of us to pause and reflect on what needs to be done to provide quality rights based on mental health services for the people of South Africa. During the World Health Organization May 2021, government from around the world recognized the need to scale up quality mental health services at all levels. As government of the day, we have adopted a human rights lens in developing a mental health care as well as in drafting a national mental health policy framework and strategy plan 2013-2020 that is currently under review. The strategy seeks to address the mental health care services in the country and has put mental health care at the epitome of the departmental priorities. All provinces are to strive in ensuring that the said targets are met. I'm pleased standing here to report that as a province, we are also committed in ensuring that we meet those targets. Hence, the Honorable Premier has pronounced the building of a psychiatric hospital in Mpumalanga. This shows the commitment we are having in increasing access to mental health care services. We've also taken a conscious decision that all hospitals that are to be built or refurbished going forward will have a mental health care unit that meets the set standard of care of mental health care users. This financial year, we are commencing with the construction of the psychiatric unit in Kwamhlanga using the newly approved prototype plans for district hospital. Currently, the department is having 28 hospitals providing the 72-hour mental health care assessment. After 72 hours of assessment, the patient who still needs to be admitted is then transferred to the 3 hospitals, which is our regional hospital, which is Temba, which is Mapulaneng, and Emelo, where we are having dedicated mental health wards. In increasing the number of beds and access for mental health patients, the province also contracted a Citizen Life Care that is assisting the province on provision of mental health care services for long-term care and pediatric mental health care services. We are offering bursaries to doctors to go and specialize, building our own cadre of specialists. We are expecting to receive the first psychiatrist that has come out of the provincial project. His presence will partly address the need we have of psychiatrists in the province and increase access to mental health care. As you know that we're a rural province, it becomes difficult. Hence, we have taken a decision as a province that let's take our own and make sure that they go and specialize and come back and serve the province of Mpumalanga. We have advertised the post of the Mental Health Care Provincial Director to be in line with the recommendation from the National Strategic Plan on Psychiatry, and all our sub-districts are having mental health coordinators to strengthen the community mental health care services in the province. As an intervention to community level, following the impact of COVID-19, the province contracted psychologists and registered counselors who are based at primary healthcare level to ensure that community members can access services on mental health counseling in rural areas where they are staying. The quality of mental health care service provided is vital to us. Hence, the province has appointed 3 review boards, one for each district to provide an oversight on mental health care services and review the quality of care given. The province is striving in ensuring that all communities are also empowered on understanding and preventing mental health illness through community campaigns and community dialogues. We agree, Chairperson, that mental health services in South Africa need radical transformation to provide significantly improved access and quality of care to patients and the population at large. These align with our call for movement towards universal health coverage, which provide an opportunity for strengthening mental health services. Practically, this means that as we design our national health insurance system, we need to agree on a package of mental health services to be provided, including a focus on prevention and wellness at each level of care. Equally, we need to deal with the social determinants of mental illness with an intersectoral focus on reduction level of poverty and inequality, increasing gender equity, improving access to employment and educational opportunities, and decreasing level of interpersonal violence. I have already mentioned that we are having only 27% of South Africans with severe mental disorder receiving treatment, one of the contributing factors being the stigma associated with mental health care services. Honorable Chairperson, scholars define stigma as the mark of disgrace because of stereotype and misunderstanding. The fundamental question is how do we break the vicious cycle of stereotype and misunderstanding? A simple act of cyberbullying and also internet can easily result to loss of life, and we have to see happening, especially for school children at the adolescent age. Hence, our program will go down from primary level because we can't assume that children they can't have mental program. Hence, our program goes down to at the level of children. In the society, mental health is stigmatized more than prevailing challenges that humankind face. We need to change this, and we appeal to the nation and members of the community to tackle mental health related issues with extreme caution. We as leaders and lawmakers, as well as stakeholders, mental health care fraternity needs to join heads and double our effort in dispelling the myth, misinformation, and stigma associated with mental health care. People suffering from mental health are not met as the stigma goes. We need to dispel this urban legend and we stand a good chance to win the fight against mental health care if we join hands and dispel as communities and as the people of South Africa. The fight of mental health and stigmatization should start in our communities and school in particular. Institution of learning should include mental health care in their curriculum. I'm happy that in the province, we know that they are also having dedicated people, especially at the level of higher institution of learning, of which we want to partner with the CEO of the TVET to make sure that we take the program as a province also at the TVET level, so that when we start there, even those ordinary people at the community level will be able to understand that it can happen to anyone, young and old. So this is where our programs are going to go. For a few weeks ago, Chairperson, I visited one of our facility in Belfast, Tutuka in Belfast, and I found out that there are close to 90 mental health care users who were discharged to be integrated into the community because they were assisted to be able to function well at the community setting. But their families are not accepting them back. Some of their families are no longer a trace, and I'm aware that this is now a social issue that we are trying with our social workers to resolve it. My point here is that we cannot have communities who are stigmatizing one of their own because of mental illness. That can affect anyone at any time. We need to be able to embrace each other. So families need to play a very important role for us to be able to deal with mental health in the province. One of the misconstrued we need to dismiss with the concept deserve is that being admitted to a psychiatric hospital means having your freedom taken away and being secluded from society. In fact, this will allow patients to appreciate, to have an encounter with those that may be experiencing the same related challenges. It also gives the person time to recollect himself or herself with the support of experts who are dealing with the mental health issues. Chair, there is a thin line between mental health and gender-based violence. Most victims of gender-based violence experience horrific abuse at the hands of those that ought to protect and incubate them. Most often than not, victims of gender-based violence take time to heal from the brutal ordeal that they experience. Some of them mental health challenges are engineered and are consequence of gender-based violence. As a province, we are happy that our Department of Community Safety, Security and Liaison are able to go and make sure that they work with the victim of gender-based violence, and also department will work with them so that we are able to deal with mental health in a province. That is why we mobilize all sundry, and while we deal with the mental health challenges, which is undoubtable one of the most brutal silent killers, let us tackle the struggle of the gender-based violence pandemic. We need to strengthen our system in all sides to identify, monitor, and report suspect act of gender-based violence if we seriously of overcoming mental health challenges. The World Health Organization has advised that, as I quote, during times of stress, pay attention to your own needs and feelings, engage in health activities that you enjoy and find relaxing, exercise regularly, keep regular sleep routine, and eat healthy food. Keep things in perspective. Thus, I am calling of all to preach this message to our communities and society at large, so that those with healthcare sectors, to encourage everyone to heed the call from the World Health Organization for their own mental health well-being. Chairperson, as I conclude, I want to end by quoting Dwayne Johnson, popularly known as The Rock, who said, "I found with depression, one of the most important things you can realize is that you are not alone. You are not the first to go through it. You are not going to be the last to go through it," close quote. Thank you very much, Honorable Chairperson.
Thank you, Honorable MEC Manzini. The next speaker is Honorable Lont. Honorable Lont.
Good afternoon, Chair, and honourable ministers and honourable members. As is often the case with debates such as this, there are many valid points made by speakers across the political spectrum. If I just came to this country and I didn't know much about its history, I would have been encouraged about the bipartisan approach that this debate is taking. If I may use the term, Honourable Mazzini, in a normal society, there would still be thousands, if not millions of individuals who struggle with various mental health challenges. Unfortunately, in our beloved country, it cannot be described, and we cannot be described as normal. We have one of the highest unemployment rates in the world. This is even worse among the youth. the mental turmoil that millions of South Africans have to go through because they cannot find a decent job to look after their loved ones. It is not normal and it is not acceptable. The constant strain South Africans are under, whenever they step out of their homes, having to be vigilant for their own safety because of a violent and dangerous society. This is not normal and it is not acceptable. Even worse, this strain we are under is often experienced in our very own homes. This is definitely not normal and not acceptable. The despair, because the leaders in the majority of towns, provinces, and the leaders of this country seem not to care. They only look after their own corrupt interests and those close to them. This is not normal and this is not acceptable. Linked to the first point of unemployment, the anxiety that comes with poverty and how that translates to future generations with an education system that is generally skewed to cater for those who have instead of those who have not. The fact that children, through their own ability and hard work, will generally struggle to lift themselves out of their circumstances due to an incompetent and corrupt education system. This is not normal and this is definitely not acceptable. If you or your loved ones become sick in this country, South Africans must hope and pray that maybe there's an open bed, an available medical professional that is not at the end of his or her tether, and hopefully available medication. All because our health system has been allowed to deteriorate more and more over the years. This is not normal and this is not acceptable. We are being abused as a country by the current leadership, a leadership that do not value and a leadership that do not appreciate that this country belongs to all of us who live in it. It's not normal and it is not acceptable. There is, however, hope. We have an opportunity to care for one another. We have an opportunity to look after the well-being of one another. It is normal and it is acceptable to change the trajectory of our country. It is not normal that we ignore all the strain we are put under. We must face up to this. Honorable members, all of the beautiful words we have said today, it cannot become reality unless we change the way the current government operates. Therefore, it is normal and it is acceptable to register to vote, because only when we will have a change in national government will we have a caring government that uses state resources to look after the most vulnerable of the most vulnerable, which are those that suffer with mental health. It is normal and it is acceptable to look after those individuals, as it should be. I thank you.
Thank you, Honorable Lond. I'll now invite Honorable Nchabeleng. Honorable Nchabeleng.
Thanks, Honorable Chairperson, and let me take this opportunity to say good afternoon or good evening to the team from the Ministry of Health, led by the DM, Dr. Romo, the chairperson of the NCOP, the chairs of chairs, and the team of the NCOP, and all the MECs who gave their inputs from their provinces. Chairperson, it is an imperative of our constitutional democracy that we need to ensure that all our people reach their full potential and have equal opportunities. Social transformation is anchored on ensuring that our people are able to liberate themselves. Chairperson, I was listening to Honorable Lon, and for some time, I agreed with some of the things he was saying, raising, that shows concern, that as a South African, we see South Africa as a whole, as one country. As one country, and that the solutions that we come with should be the solutions that will be able to benefit all South Africans, regardless of where they stay, which corner of South Africa they live in. But then he got lost in the process because of his hatred of the African National Congress, that then he misses the point and joined the whaling team. Listening to members who were debating here, there were points raised by Honorable Baha. Honorable Baha, the ECD money will always remain as a sad moment in our history. And that what we need to do is, what do we do from here going forward to ensure that what happens does not recur? The deputy minister leading the ministry, he mentioned, steps that they are taking as a department to ensure that we turn around the Department of Health, particularly the mental health area that we are debating upon. And that the challenge with us is how do we, as members of as leaders of political parties, and as members of parliament, and at the same time, as society as a whole, through NGOs and other mass-based organizations in the country, how do we input on this to this task team that is established to turn things around? That should be everybody's concern on how do we reach this body and make our inputs to it. But instead of doing that, we just go on criticizing and not coming up with solutions. The critical question in this debate, Chairperson, is in the context of this debate is, what is government and society? What is government and society doing, broadly should do in order to create a conducive environment to harness the human potential of all South Africans in the midst of declining economic opportunities, the increase in unemployment, growing poverty, and deepening inequality. This deepening inequality is so glaring in the Western Cape, Chairperson, where you can actually see where Black people live. That is where the poor people live, poor infrastructure and all. You look at the Western Cape in terms of, how people live in that province. Everybody want to talk about the Western Cape. The first thing that comes to mind is drug trafficking, drug abuse, gangsterism, and all this. And all this combined with the economic depression will lead to challenges in mental health. The social reality of all South Africans cannot be isolated from the economic reality of all South Africans. Unemployment and poverty are one of the factors which induces a lot of depression for youth, in particular, those young people who have to, at an early age, after losing their parents, take responsibility of being parents and having to fend for themselves and their siblings. This also could lead to a severe depression and mental health challenges for the children. And this is not only happening in Gauteng or other provinces. It also happens in the Western Cape, where the unemployment is also high. And this will call for a multi-dimensional intervention on the causal factors which contribute to mental health, which is the result of external factors rather than medical or biological factors. I want to refer our friends from the DA to listen to listen to what one of Shudufadzo Musinda Karadzianga, who placed mental health as a core focus she highlighted key issues in order to address mental health. The facts she advances are critical, which inform us that one of the most challenging things about mental health is that it is not spoken about enough. Mental health conversations are needed in order to promote well-being and to diagnose. 1 in 4 people are expected to suffer from mental health issues in their lifetime. This is what former Miss South Africa said. And she said again, there's a common misconception that mental illness do not affect the children. It is difficult to identify a mental illness until you know how to look for it. Separating the person from the illness is key to ending the stigma. One common sign of mental illness is that the daily activities you do becomes hard to achieve. That's when you know that it's creeping in. Working environments are also another factor which contributes to stress and frustrations, which results in mental health challenges for many employees. It is for this reason that health and wellness divisions in all workplaces are a necessity in this regard. Part of responding to mental health is through ensuring that all workplace health and wellness units focus on the mental health of their workers. The call for psychosocial support in our schools is another call which should be realized. Because in schools, children experience bullying and various pressures which are also induced by inequalities. A child who comes from a family where they live in a shack and they share a room being 5 will be different from a child who has a room to him or herself. The nation was in pain last year when a learner from Limpopo, Mbilwi High, committed suicide due to bullying. What is evident is that bullying is not only located in schools, but also broadly in society. Abuse and gender-based violence are among some of the factors which contribute to mental health. Chairperson, the persons with mental illnesses should be supported in our society, and all should not be treated as in a discriminatory manner. Ensuring that all our health facilities and special schools have the necessary facilities to support persons with psychiatric problems is critical. Government needs to intentionally streamline persons with mental illnesses into productive economic opportunities. At least all these socio-economic factions, Chairperson, contribute in exacerbating mental health problems. Social media platforms, cyberbullying, and crass materialism is another growing phenomenon which feeds into social pressure amongst the youth and those in the social media platforms. Cyberbullying, particularly in social media platforms, have destroyed many lives and led to many into the path of depression, whilst others have committed suicide. One of the portfolio of education meetings where a kid in the Western Cape, in the Eastern Cape, committed suicide because of bullying, because she had ancestral spirits and she was seen as being evil. So that is another form of bullying that leads to mental illness, that leads to people committing suicide. The United Nations International Children's Emergency Fund defines cyberbullying as bullying with the use of digital technologies. It does take place on social media, messaging platform, gaming platforms, and mobile phones. It is repeated behavior aimed at scaring, engaging, angering, or shaming those who are targeted. Examples will include, Chairperson, spreading lies about or posing embarrassing photos of or videos of someone on social media. Another one will be sending hateful, abusive, or threatening messages, images, or videos via messaging platforms. Impersonating someone and sending mean messages to others on their behalf or through fake accounts. We have all experienced this. We have seen it in social media. There were people who post as others, insulting others, on social media. It is important that families and various social institutions such as schools, religious organizations, and civil society join efforts of supporting mental health affected persons. A societal response to mental health problems will first and foremost require awareness of the people. Our interaction as human beings should be guided by values of compassion and solidarity. This means that when someone looks distressed or is frustrated in our homes, in our schools, in our churches, in the mosques, at our workplace, in parliament, and other spaces of close interaction, we should always be concerned about the well-being of others. The spirit and value of Ubuntu, which have characterized the civilization of Africa, should be reinvigorated in our society. Our civilization should encompass high level of social relations and harmony, which remains an imprint of Africa and its renaissance. In order to respond to problems of mental health, a comprehensive approach to addressing mental health through creating a conducive socioeconomic condition is critical. This means that the agency of implementing the economic reconstruction and recovery plan should be expedited to change the living conditions of the marginalized who are strained by their conditions.
As you round off, Honorable Nchabelen.
Yeah, I was just saying that, Chairperson, the MEC Mamuketi from Gauteng has summarized it by saying that mental health is a responsibility of all citizens of this country, and I thank you.
Thank you, Honorable Nchabelen. Allow me, thank you, honorable members. Allow me now to invite Honorable Dr. Jomo, who's MEC of Health in our beloved South Africa. Honorable Dr. Jomo.
Sorry, Chairperson, I'm not the MEC for Health.
I'm saying Honorable Deputy Minister, Honorable Dr. Jomo. I'm sorry if I said MEC, Deputy Minister. Sorry, DM.
What's in the name after all, Chair? What's in the name? What's in the title?
Hey, Honorable Hot Chocolate. Let's allow the DM.
Yes, no, thank you very much, Chairperson. And I would like to thank all the members who participated in this debate. It is actually clear that from this debate that mental health is a critical matter and priority across various sectors in our society. But before I just deal with all my closing remarks, I wanted just to start by saying I want to give Honorable Luthuli a benefit of doubt that probably she logged in late. She had not heard my speech because she then said there is no strategy on the issue of mental health. There is, Honorable Luthuli, who can forward it to you and look at it and then find it worthwhile to read. To Honorable Bach, yes, it is true, Honorable Bach, I agree with you, it's a worldwide phenomenon where we seem not to be paying much service to mental health. And that is why I think this debate was critical, because all of us, not just South Africa, the whole world is really behind in terms of giving its best in terms of that. But I want to say, yes, maybe Life as City was a turning point for our country. I was an MEC for Health in KwaZulu-Natal at that time. The former Minister of Health, Dr. Mtswaledi, called all of us as MECs to actually unpack that situation. And from that day onwards, we knew now that we then knew that we have to do something very different about mental health. So all the programs that MECs have outlined here actually have been accelerated, especially after SCD. So we would want to say, as we were saying, we should not have any again in it. I think it was unfortunate, the comment from Honorable Lund, because from our debate, we're also raising that issues of migrant workers has an impact on mental health. And now there is no, this is a privilege that white males never had. And probably from his society, he has not been aware that a lot of us were raised by single moms, not because our parents were not there. Our fathers were in the mines, and therefore we had to actually, that sequelae of a mental illness in families, in children who are raised by single parents, because this apartheid government had decided that all males who are black must go into the mines, is something that we must not underestimate. It had an impact. It was a very inhumane process. And I think want to also to say some of us are learned coming in from a system that was a Bantustan, that a white man would never understand what it is, what impacts it has. And all that, again, those inequalities had a sequelae in terms of poverty and unemployment that we see. While we covered some ground on mental health and substance abuse, particularly on legislative and policy development, it is imperative that we put systems in place to improve, continue to improve. Yes, COVID-19 has eliminated some of those gaps. We need to actually move with speed to actually adopt a public health approach in order to comprehensively respond to the social determinants of mental health. This includes poverty, illiteracy, unemployment, and inequality. We have highlighted that mental health promotion and prevention of mental illness is a game changer, and that's why we're talking about the public health approach. This includes the public education initiatives to improve knowledge about mental health and illnesses, reduction of stigma, and also what Honorable MEC Manzin was talking about, the gender-based violence. We further recognize the need to improve the mental health human resource capacity, and we are concerned about these issues, Honorable Chair, and therefore that is why we'll continue to work on this. And I actually was happy that MECs were here indicating their strengths and their programs in the various departments, in various provinces. I just want to end by really cautioning Honorable Hadebe of the IFP in his maiden speech that the National Health Insurance Bill is still to come to the NCOP. It is still at the level of National Assembly, and I am surprised to hear what he's saying, because as a former chairperson of that portfolio committee, we had support of the National Health Insurance from the IFP members in the National Assembly. Anyway, I would not want to debate that, but I just want to raise the truth that is an equalizer. And National Health Insurance will be an equalizer of all these inequities, all these abnormalities that we see in health, where the haves will always be privileged. And we want to say health will be a public good, including mental health will be a public good that is actually not going to be accessed by those who have money and those who do not have. So that is actually embedded in that policy, including the mental health. So I think I want to say, as I close, we take all the concerns, all the comments that were raised by the members. They are very constructive, quite a lot of them, but some of them, yes, were just politicking, which we can always discard. But those that are very constructive, which we got from the members, as a department, we are going to make use of them in advancing and improving our. We never said as a government or as an ANC, we have all the wisdom. We welcome these ideas. We'll take them all on board, Honorable Chair. And I thank you very much for holding this debate in the NCOP. Thank you very much.
Thank you, Honorable Deputy Minister Dr. Zomo. Honorable delegates, that concludes the business of the day. I wish to thank the Deputy Minister, Honorable Dr. Zomo, special delegates, our MECs from our respective provinces, SALGA representatives for availing themselves for this very important debate. The House is now adjourned. Thank you very much.
Thank you, Baba.
Thank you.
Thank you.
Thank you.
Recording stopped.
Thank you, Sabong.